Welcome back, everyone. I'd like to call the meeting to order. The committee has under consideration the estimates of the Ministry of Health for the fiscal year ending March 31st, 2023. I'd ask that we go around the table and have members introduce themselves for the record. Minister, please introduce the officials who are joining you at the table.
Thanks again, and it's good to be back after our session this morning. Thank you, Chair. So there's myself. We have Mike Ellis, Minister of Mental Health and Addictions. We also have Deputy Minister Winnick at the table. We also have, sorry, I just lost my, Aaron, sorry, Aaron Newmeyer and Evan, sorry, my apologies. I'm terrible with names. Deputy Minister as well. Thank you.
My name is Jackie Lovely, and I'm the MLA for the Camrose constituency and the chair of this committee. We'll be starting to my right with introductions, please.
Good afternoon, MLA Tracy Lard for Grand Prairie.
Good afternoon, Mark Smith, Drayton Valley, Devon.
Minister for Benefit, Roger Reid, MLA for Livingston McLeod.
Richard Gottfried, MLA, Calgary Fish Creek.
Mickey Amory, MLA, Calgary Cross.
David Shepard, MLA, Edmonton City Centre.
Good afternoon, Laurie Sigurdsson, Edmonton Riverview.
Rod Loyola, Edmonton Ellerslie.
All right, and now, pardon me, we'll go to members participating remotely. Please introduce yourself, sir. Mr. Hunter?
Grant Hunter, MLA, Table Order.
I'd like to note the following substitutions for the record. Mrs. Allard is substituting for Mrs. Fry. A few housekeeping items to address before we turn to the business at hand. Please note that the microphones are operated by Hansard. Pardon me. Committee proceedings are being live streamed on the internet and broadcast on Alberta Assembly TV. The audio and visual stream and transcripts of meetings can be accessed via the Legislative Assembly website. Members participating remotely are encouraged to have your camera on while speaking and your microphone muted when you are not speaking. Remote participants who wish to be placed on a speakers list are asked to email or send a message into the chat group to the committee clerk. And members in the room are asked to please signal to the chair. Please set your cell phones and other devices to silent for the duration of the meeting. Honourable members, the standing orders set out for the process for considerate of main estimates, a total of 6 hours has been scheduled for consideration of the estimates for the Ministry of Health, and I'd note that the committee has already completed 3 hours of debate in this respect. As we enter our 4th hour of debate, I will remind everyone that the speaking rotation for these meetings is provided under Standing Order 59.016, and we're now at the point in the rotation where speaking times are limited to a maximum of 5 minutes each for both the member and the ministry. During the portion of the meeting, the member and the minister may each speak once for a maximum of 5 minutes, or these times may be combined. Pardon me, making it a 10-minute block. Please note that the combined speaking time of the minister, associate minister, and ministry staff cannot exceed 5 minutes at a time. Please remember to advise the chair at the beginning of your rotation if you wish to combine your time with the ministers. One final note, please remember that the discussion should flow through the chair at all times, regardless of whether or not speaking times are combined. With the concurrence of the committee, I will call a 5-minute break, probably just before 5 p.m., and that we will get the best coffee. Does anyone oppose having a coffee break? All right. When we adjourned on this morning, we just passed 5 minutes into the exchange between Mrs. Fry and the Associate Minister. I will now invite a member from the UC caucus to complete the remaining time in the rotation. Member Allard, you have 4 minutes and 42 seconds.
Thank you very much, Chair. So I wasn't here this morning, but I believe that we left off with a question to the Associate Minister of Mental Health and Addiction. So I'm just going to repeat the question because I don't think you got to answer it. In reference to the Ministry Business Plan on page 52, the second paragraph states that Ministry policies, programs, and initiatives for wellness, disease, and injury prevention, early intervention, and managing chronic health conditions support Albertans in optimizing their health. Government and community partners continue to expand access to a recovery-oriented network of community-based services and supports to achieve improved health and quality of life for those living with or at risk of addiction problems or mental health issues. So the question is, who are the community partners, Minister, that we are working with, and how will this expand access to the recovery-oriented system of care?
So
Thank you, member, and thank you very much for the question. Earlier this morning, I did have an opportunity to actually talk quite a bit, but I'd like to continue with some thoughts in regards to that recovery-oriented system of care and the partners that we're working with. Thank you very much. You know, in Calgary specifically, we're working with the Alpha House and Simon House Recovery Center, Recovery Acres Society, Fresh Start Recovery Center, the Alcove Addiction Recovery for Women, Sunrise Healing Lodge Society, Aventa Recovery Center of Excellence for Women with Addictions, in Edmonton, specifically working with the George Spady Society, the Pound Makers Lodge Treatment Centers, the Jelnik Society, Our House Addiction Recovery Society, Salvation Army Edmonton, Recovery Acres Society Edmonton, and the McDougall House Association, also in Edmonton. Numerous, there's numerous more in southern Alberta, central Alberta, and northern Alberta as well. But I think it's important to recognize all the great work that all of these people do in the, not just the, when I mentioned earlier, when we talk about recovery-oriented system of care, we can substitute the word recovery, for wellness or human or holistic. But it's important to note that all of these focus on the entire body, both mental and physical, for that individual to ensure that they're receiving the total care for the illness that they have.
Thank you so much, Minister. Honourable member.
Thank you, and if I may continue with another question to the same minister. On page 9 of Budget 2022, it states that the government is building on existing commitments to transform the mental health and addiction system to ensure Albertans have a continuum of high-quality mental health and addictions care and supports. The government will implement a recovery-oriented system of care that is person-centered and builds on the strengths of individuals, families, and communities. A recovery-oriented system of care that will offer a coordinated network of community-based services and supports for the whole province to be included. We are excited to anticipate celebrating the outcomes indicative of wellness and recovery for Albertans. Budget 2022 increases the investment into Alberta's addiction and mental health system by $20 million. The new funding will focus on child and youth mental health as well as furthering efforts to build a recovery-oriented system of care in Alberta. I'm just wondering if the minister can explain to us where we're at in that process and if the budget has been allocated directly.
Yeah,
And sorry, just a reminder, everyone, that the conversation needs to flow through the chair.
My apologies.
Thank you, Madam Chair. As the member indicated, $20 million in additional supports on top of the $140 million over the past several years. In response to the 2022-2023, of course, we have the $32 million for services that reduce harm, $10 million for prevention, $23 million for early intervention, $117 million for treatment and recovery for addiction and mental health. That on top of many of the initiatives that are quite groundbreaking, including the virtual opioid dependency program, which essentially allows people all throughout the province to get treatment on demand with evidence-based medication such as methadone, Suboxone, and of course another groundbreaking evidence-based medication which is Sublocade, which is an injectable.
Thank you so much, Minister. And now our time moves over to the official opposition. And please proceed, Honourable Member.
Thank you so much. I'm happy to be here today to ask some questions of the Health Ministry. I'd like to start in the estimates on page 112, 1.6, which is the Health Advocate's Office. And back in 2020, we did have a Seniors Advocate Office at that time, but that was cut from the budget. And $500,000 was cut from the Health Advocate's Office. And but the Minister of Seniors and Housing said that seniors would still have someone who was a champion for them, who would listen to the concerns. The office workers would do casework for them, and that seniors would be well served. However, when I asked the minister this question, she said, no, you have to talk to health about this, and she hadn't, she indicated she hadn't had anything to do with this. So that's why I am bringing this here. So I guess I'd like to know, we do have one report from the Health Advocate from 1920, but the ministerial order says that the report should be tabled every year, annual report, and we've received nothing since that time. So nothing in 2020, 21. And so, I'm at a loss to know what's going on with the Health Advocate, and is indeed she serving seniors. We know that just about 28% of casework is related to health and many other areas, financial issues, housing, home support, social supports. These are all other areas, so I'm just wondering what the Health Advocate is doing in those areas. So I'd like to know from the Minister how many times you've met with the Health Advocate. Madam Chair, and to receive some updates, because the report is obviously overdue significantly. So if you can speak to any of that, please, through the Chair.
Thank you so much, Honourable Member, and back to you, Minister.
Thank you to the honourable member for the question. Now, I meet quarterly with the Health Advocate, and my understanding is that when the change was made in terms of passing along the work from the Seniors Advocate to the Health Advocate, staff also went with the Health Advocate, and the Health Advocate continues to do work in supporting not only the health of Albertans, which you correctly pointed out. Many of those who are involved, concerns from the health are seniors, but also supporting seniors in regards to other queries that they have. In 2020, the first year after the merger of the Office of Seniors Advocate with Health Advocate's Office, staff received 136 inquiries regarding seniors' non-health related issues. Of those, 48 were about housing and home supports, 44 were about income and finance, and another 44 were about social supports. Data on the number of inquiries regarding seniors' health-related issues is not available because they don't actually track, whether it's a senior or not a senior, requiring health. It's just general health. We don't track that by demographic. The Office of the Health Advocate reports approximately 50% of their work relates to mental health, including seniors' mental health. Less than 10% of all calls related to seniors concerned, and most are about COVID-19 related issues in seniors' congregate living more recently. I can tell you that the Health Advocate Office has worked closely with Alberta Health, the health regions, regulators, and others to ensure the experience of Albertans, including seniors, has been reflected in both policy development and operations during the COVID-19 response. And through the pandemic, the Health Advocate has participated in numerous committee meetings, including the Continuing Care Collaborative Committee and the Family-Based Continuing Care Review. We've also met regularly with the EOC, AHS, and others to share concerns raised by seniors and their families. So I can, in general, I can share that the Health Advocate is doing work to represent seniors' interests. It's not just simply health-related work, but it's in regards to housing and home supports, income and finance, and social supports, as well as the Health Advocate has also been involved in looking at policies particularly through COVID, to protect seniors and continuing care and providing input on that. So the work is ongoing. And the work is ongoing not only related to health generally, but other seniors' concerns.
Thank you so much, Minister. Honourable Member.
Yeah, Madam Chair, I'm just wondering if the Minister can tell us, obviously the annual report is, over 6 months overdue, for the 2020-2021 year. When will that be available to Albertans? I'd like to know that. And I'd also like to know if he can speak to if the Minister of Seniors is briefed on any of the work of the Health Advocate.
Thank you so much, Honourable Member. Minister.
So in regards to the timing of the annual report, I haven't seen it yet. It may have been impacted by COVID, but I'm happy to follow up with the Health Advocate in terms of the status of that. And as you know, it will be tabled in the House. And in terms of ongoing conversations between the Health Advocate and the seniors' role with Minister Pon. Sorry, I'm not up to speed in terms of how much communication is going on between those two. You'd have to ask Minister Pon that question.
Thank you so much, Minister. Honourable Member.
Yes, thank you, Madam Chair. Well, I did ask Minister Pond that, but she suggested I talk to you about that because this is the health advocate. So it's a bit of a challenge to get answers sometimes from the government. So I'd like to move on now to the Association of Counseling Therapists of Alberta. And I know that the government had been working very closely with them over the past 2 years. And they're wanting, of course, to have the College of Counseling Therapists brought forward in legislation. They're waiting for the health ministers to support the proclamation and to take it to cabinet for approval. They're all ready to go, and we're just wondering what the holdup is, Madam Chair.
Thank you so much, Honourable Member. Minister?
So maybe I'll start the answer, and then I'll ask Minister Ellis to supplement. The honourable member is correct that there's been ongoing work with this group in terms of looking at a college. There was some initial concerns addressed or raised in regards to consultation with First Nations peoples. And these concerns were raised, and that was actually brought to the attention of this particular group. The work is ongoing in terms of where do we go to from here, and Minister Ellis has been front and center in terms of working with this group as it particularly relates to mental health. And Minister Ellis, if you want to comment further on that.
Thank you very much. I realize we're pressed for the 5 minutes. I know, Chair, you've warned me that, so I'll do my best here. I might actually have Evan Romano to supplement in a moment here, but what I want to say is that on June 6th, the Confederacy of Treaty 6 chiefs stated that, quote, "The development of the Alberta College of Counseling and Therapy is a direct infringement on our treaty rights to health," end quote. Of course, I don't think there's anybody here in this room that would disagree that we should not respect the rights of our Indigenous peoples. The minister and myself have asked the department to get some thorough consultations on behalf of the government, especially with the folks in our Indigenous communities, along with many of the other service providers. And maybe I'll ask Assistant Deputy Romano to supplement that, please.
Sure, thank you. I would just add some of the additional questions that the ministry has relate to coming out of the pandemic, looking at the workforce implications, for example, where we know opioid and mental health issues are prominent, wanting to make sure that there aren't workforce implications for service providers, for individuals who are offering those types of supports in community. There were a number of outstanding questions that we are following up with ACTA and their leadership team to try to address. As the ministers have outlined, there are some outstanding questions that we are going to need to confirm going forward. And so we're going to work through with that organization and other organizations in community to make sure we fully understand the implications before I think a recommendation can be made to government on how to proceed.
Thank you. And now back to the honourable member.
Yes, thank you, Madam Chair. Well, certainly there's, many professions in our province, social workers, psychologists, dental hygienists. This is a common practice that colleges are created and people are regulated because regulation creates safety for vulnerable Albertans. And so these practices have been in place for years, so I'm still a bit confused by why this is not, something can't be done to make this happen so that vulnerable Albertans can be protected and these professionals can be regulated to make sure that we are protecting the public. So just like the minister to speak about that. Or the associate
thank you,
minister.
honourable member. Minister?
Member, thank you for the question, but I'm not going to ignore the concerns of our Indigenous people. They have raised this issue.
And that's our time. Thank you so much. We are going to move to the independent member. Please proceed.
Thank you very much, and thank you, Minister, again for being here. I'll go straight into some questions here on government estimates, page 120, under the revenue heading near the top of the page, transfers from Government of Canada. Your 21-22 forecast of $318 million seems to be a little bit of an outlier, much higher than usual, and in fact about 109 million more than was expected. Where did that money come from and for what purpose?
Thank you so much, honourable member. Minister?
So the big increase of 116, it's 48 million, but it's basically there was the delta is related to a one-time payment support for COVID-19, which is the vast majority of that amount.
Okay, where did it come from and for what purpose?
Honourable member, please direct your conversation through the chair.
So what was the what was the purpose? And I presume it came from the federal government, so what was the purpose on that?
Yeah, no, it was from the federal government specifically to dealing with COVID-19.
Thank you so much, Minister. Honourable member.
Okay, but COVID-19 is a pretty generic thing as far as what it's for. Is there anything more specific? I'm sure there was lots of different transfers for COVID-19, but what was that specifically for?
Specifically is...
Sorry, gentlemen, please, kindly reminder that you direct your conversation through the chair.
My apologies, Chair. So specifically it was for the immunization effort.
Thank you so much, Minister. Honourable member.
So immunization effort? Could you tell me what?
So I'll ask Aaron to provide more detail on that.
Thank you so much, Minister.
Through the chair to the member, Aaron Newmeyer, ADM of Financial and Corporate Services. So specifically this in 21-22, the Alberta government received a transfer of $116.3 million from the federal government. Very specifically, this amount was to support costs for the province for the deployment of the immunization of COVID vaccines.
Thank you so much, Minister. Honourable member.
Okay, again, I just understood immunization. What part of the immunization process was it for?
Thank you so much, member. Minister.
Through the chair to the member. So again, all provinces received, first of all, I should mention that the federal government paid for the cost of the COVID vaccines, but provinces were responsible for the cost of deployment and delivering those vaccines to Albertans. So this transfer was specifically provided from the federal government to partially offset the cost of deployment of vaccines to Albertans.
Thank you so much, sir. Back to you, honourable member.
Okay, so deployment of vaccines, would it have anything to do with the restriction exemption program?
Thank you so much, honourable. A point of order has been called. Please go ahead.
Just, Chair, just to 23 BI speaks to matters other than the question under discussion. With respect to the honourable member, we're looking at the 2022-23 budget. We're not looking back to previous years. So if we could just get back to our main estimates for this budget, that would be appreciated. Thank you.
Thank you so much, honourable member. Can you rephrase your question and then point towards estimates, sir?
Okay, yes, it's on government estimates, page 120, and those numbers are all on that page, so I would presume that they were available to be discussed in this meeting. So I'm pretty certain we've already discussed the $318 million. We've discussed the $116 million of support, which is what we're discussing right now. So I just wanted to get an answer on that, please.
Sure. Thank you, honourable member. Minister.
So just for clarity, when we're talking about immunization support, that was associated partially offset the costs of, for example, we had pharmacies, we paid a charge associated with that. AHS hired staff, right, to be able to run immunization clinics. So that's what it is. This had nothing to do with the REP.
Okay.
Thank you, Minister. Honourable member.
Okay, thank you very much. We'll go on to page 114 of estimates, line 15.1, capital grants for continuing care beds. You budgeted getting $50 million out the door, but only paid out $6 million last year. Any reason why that happened, especially when we know that at any given time, approximately 15% of our hospital beds are being occupied by people who should be somewhere else in more appropriate care settings, for instance. If we had a capacity problem, it seems that every effort should have been made to address those people in our hospitals who could have been in continuing care instead. So again, why was there $50 million budgeted and only $6 million go out?
Thank you so much, honourable member. Minister.
So thanks to the honourable member for the question. So due to COVID, there was a delay in the spending of this money, so we reprofiled it to future years.
Thank you so much, Minister. Honourable member.
Thank you. Still on page 114, line 8.2, inventory acquisition immunization support. Why the large increase this year, even exceeding the increase last budget?
Thank you so much. Minister?
So the increase of 14.3 million is related to the approval of the high-dose influenza vaccine for Albertans 65 years of age or older.
Okay, thank you. Can I go ahead?
More questions?
Yeah. Okay, page 113, line 10, human tissue and blood services. Why the huge increase in cost there, about 30% growth in 2 years?
Thank you so much. Minister?
Sorry. Cost relates to Canadian Blood Services contract, increased demand for plasma-derived products, and the introduction of new products that are more costly, which increase the price of the contract. And then also has to deal with a increase for the Provincial Bloodborne Cancer Therapy Program, or CAR T cell therapy.
Thank you, Minister. Member?
Thank you. Thank you very much. We'll stay on page 113, line 6.2, addiction and mental health. We have seen catastrophic increases in drug overdoses, obviously. Prior to the pandemic, we had 100 deaths in 1 month was a record. Now we have never been under 100, some months hitting 150. And nearly $8 million in budgeted but unspent addiction and mental health money last year. So why did that happen? Why wasn't that money spent? And what is this government doing with that? Such a dramatic increase in drug overdoses.
Thank you, Member. Minister?
So, thank you, Member. So we're just looking for the actual answer for you. But to just supplement, yes, it's not just unprecedented here in Alberta, it's certainly unprecedented everywhere in Canada and North America. You know, we've developed a system of care. Thank you, and just to answer your question there, so the increase of 7.9 million is a result of operational funding not required in the 2021-22 due to the delay in opening of the residential treatment facilities. So hope that answers your question. Thank you.
Thank you, Minister. Member?
Thank you. Yep, that answers that. Thank you very much. Page 113, line 11.1, program support. Again, huge increase, 60% in 2 years. Why that increase on that program support?
Thank you, Member. Minister?
So thank you to the honourable member for the question. You know, this program support is in relation to a number of items that includes increase. So it's a total of $3.7 million. You know, so part of that is increased staff to deliver on government priorities and meet health systems demand. Also funding related to the to revalidate the Alberta Healthcare Insurance Plan registrant, and then also the staff to work towards a new modernized personal health card.
Thank you, Minister. Member?
Okay, thank you very much.
All right, and that's our time. We'll move back over to the government side, and we'll proceed with Member Allard.
Thank you very much, Chair, and through you to the Minister. I'd like to talk a little bit about palliative care. So I'm on page 113, element 8.5. Palliative and end of care deals with a part of healthcare that most people do not want to think about. So I certainly don't want to think about it. While death is difficult, it is inevitable, and a compassionate system ought to expand end-of-life care to ensure that those in that situation and their family members know what to expect and have appropriate options for those family members. So looking on page 113 at element 8.5, of the estimates, I'm just curious how the 5 million in palliative care budget for 22-23 will be allocated. And my second question is, the funded initiatives under the palliative and end-of-life care call for grant proposals, what will they achieve?
So much. Thank you so much, Honourable Member, and over to the Minister.
Thank you, Chair, and thanks to the Honourable Member for the question. The $5 million in 8.5 is part of a $20 million government commitment to enhance palliative and end-of-life care so Albertans can have better access to appropriate, timely, and quality supports and services. Part of the funding will be used for existing palliative projects with Covenant Health, the Alberta Hospice Palliative Care Association, and Pilgrim's Hospice, as well as provide coverage for the costs associated with pre-filling syringes for clients on the palliative coverage program. The second part of the funding will be used for new grants from the palliative and end-of-life call for grant proposals, which closed in January 2022, and recipients are expected to be selected by the end of March of this year. In regards to your second question, funding support gaps, the entire 20 million and what the objective is to support gaps in palliative and end-of-life care that were brought forward during MLA Williams' engagement, which includes earlier access to palliative end-of-life care, education and training or community supports and services, and palliative research and innovation.
Honourable Member.
Thank you. I just have one final question. It's actually back to the Associate Minister. I'm looking at our discussion about people living with mental health and substance use orders, and they've been more deeply impacted by the pandemic, often losing connection with professional, social, and emotional supports they require for their recovery. And when I look at the budget, I'm just looking for the reference line here. I think it's on page 9 of Budget 22. COVID-19 pandemic has put added pressures on the addiction and mental health system, creating the necessity for more virtual and phone addiction and mental health resources and supports. Can you tell us how this funding is broken down and when it comes to funding for treatment services specifically?
Thank you so much, Honourable Member. Minister.
Thank you very much. As I already mentioned, the virtual opioid dependency program, which is certainly groundbreaking, but going back to your original part of your question, of course, COVID-19 pandemic and public health restrictions over the past 2 years have just impacted all of us in Alberta, quite frankly, especially when it comes to mental health and mental wellness. And that's why early on this government committed $53 million. That's more than, quite frankly, Madam Chair, any province, to make sure that we have access to addiction and mental health supports and that they need during this pandemic. This was a commitment on top of already significant investment in mental health and addiction services across Alberta. We tried to provide the most comprehensive pandemic supports in Canada to make sure Albertans have what they need and certainly when they need it. We had, what we were doing in my ministry and under the leadership, of course, of the Deputy Minister and the Assistant Deputy Minister, we were handing out many grants, again, with a lot of great people doing great things in this province, especially. And we do what we do in Alberta, right? We come together as community, as family, and and that's why enhancing phone and virtual resources, supporting more than 200 organizations to meet the unique needs of communities, and that's that get her done attitude that we have here in Alberta. Supports also continue to be provided to AHS, as well as for the addiction and mental health community clinics located right across this province. So it's very complex. Mental health is very complex, but we're doing our best, of course, to meet the needs for the people that need it the most. Thank you, Madam Chair.
Minister. And I understand now we're moving over to Member Amory. Please proceed.
Thank you very much, Madam Chair, and thank you to the ministers and their officials for being here this afternoon and for answering our questions. My question, again, will be directed to the Associate Minister, and it relates to something that I think he is incredibly passionate about and that he has spoken about and he has personal first-hand experience with. And that is specifically, Minister, supporting police officers, first responders, and frontline workers. Now, I'll direct the Minister through you, Madam Chair, to page 127 of the 2022 fiscal plan, where it states that Alberta spends approximately $1 billion on mental health and addictions. We've seen through the pandemic the incredible role that our first responders, such as EMS professionals and police officers, have made, and those contributions have been integral to our communities. There's very little that I can articulate here this afternoon to describe the amount of indebtedness that we all have for their sacrifices, but it has become even more evident so throughout this pandemic that our first responders and frontline workers are essentially part of the solution to improving community wellness. But what we don't talk about, I think, enough is how much our first responders require in the way of mental health supports themselves. Again, to the Associate Minister of Mental Health and Addictions through you, Madam Chair, you have a $1 billion budget with respect to mental health and addictions. What can you tell us? What can you tell this committee about the roles that first responders have to play in further supporting our communities when it comes, in particular, to understanding the evolving needs of mental health issues? And what is the ministry doing with respect to assisting those individuals with their own mental health issues?
Thank you so much, Honourable Member. Over to you, Minister.
Thank you. I'd like to thank the member for the question, and certainly thank him for recognizing the role of first responders, whether it be police or EMS or fire or anyone that has that safety sensitive occupation, and one where they're really taking risk, right? And the risk is on behalf of you, right? The people of Alberta, everybody in this room, without any fanfare, without any desire for recognition. I know personally members that I have worked with in the Calgary Police Service, as well as other organizations, one of whom who reached out to me not that long ago, one that I hadn't seen actually in quite some time, and the deep emotional scars that he had in a call that he attended as a detective, for which I was actually the on-duty staff sergeant for a brutal homicide, 5 young people that were brutally murdered, was more than he was able to handle, to the point where he's no longer a member of the Calgary Police Service. Now, I know many organizations provide, police services do their best to provide mental health supports for their members. And, I remember just recently working with the now Justice Minister and was the Minister for Labour to ensure that, all organizations in this province have a comprehensive plan to assist people that are dealing with emotional concerns, especially as it pertains to mental health. And, that's stuff it's ongoing. But I will say that there's a lot of great stuff. We have, you referred to page 127 of the fiscal plan. I'm just looking here, with funding to the Heroes in Mind, the Advocacy and Research Consortium, that's the high mark, to support mental health for military and first responders. There's a lot of work being done for folks, especially the police and our folks in the military for PTSD actually in this province. And there's cutting edge, just new techniques, especially when it comes to psychedelics. I know myself personally, I was proud to be the first, call it politician to stand up and say that psychedelics time has come. So very excited to see all the innovative techniques, especially as it pertains to PTSD. And we're...
Minister, and now the time goes over to the official opposition. Please proceed, Honourable Member.
Thank you. I'd like to refer to the business plan, page 53, 1.2, modernize Alberta's continuing care system based on Alberta's facility-based continuing care and palliative end-of-life care reviews to improve services. So, I think something that I'm sure the minister is well aware of, and I certainly hear about daily, is just the challenges with staffing in continuing care. and the lack of standards. And I know that the report that was completed does talk about 4.1 hours for each resident of daily care. But we also know that the workers in those facilities are very low paid. They're precarious workers. And I mean, I think the pandemic shone a very bright light on that, where we had, certainly in the first and second waves, the highest number of outbreaks of any province in Canada. Many seniors died in our province, in our continuing care system. And really, I think we have to look very closely at staffing. You know, these are vulnerable workers themselves. Many of them are women. They're newcomers, immigrants. They have part-time jobs with no benefits. They have to cobble together a job to be able to support their families. So I'd just like to hear what the minister has to say about staffing, and certainly the review that they did does talk specifically about that issue, and the 2017 Health Quality Council of Alberta also spoke about that. That's the top recommendation, was increased staffing to meet the needs of residents, and I think COVID, our experience with that really should create a lot of momentum for us as you know, policymakers to ensure that those facilities are properly staffed, Madam Chair.
And, thank you so much, Honourable Member. Over to you, Minister.
Well, I would like to thank the Honourable Member for the question. You know, Budget 22 does significantly increases the dollars for you know, continuing care, community care, and home care. You know, we increased the number to $3.7 billion, which is a 6.3% over last year. And we also have increased capital dollars, so over $200 million for additional continuing care spaces over the next 3 years. And this is part, as what Member Sigurdsson has spoken to, this is part of a first step in our transformation of our continuing care system. You know, our government was very pleased to be able to support the review, the facility-based continuing care review, and receive that report. We've already made steps in that direction. We fully understand that, you know, people want to receive care at home to the greatest extent possible. And we also fully understand that, you know, when people, you know, if they have to go into continuing care, that we actually need more spaces there, and we need to actually focus on improving care. So part of this year's transformation, we are increasing the funding for home care. So that enables, you know, more Albertans to be looked after at home as part of the first step, and as part of the first step as well. I'm very pleased to be we'll be introducing in the House in the near future the new Continuing Care Act. This is legislation which will take legislation that's our, you know, as the Honourable Member knows, we have it's in different pieces and different acts, bring it together into a single act, and that will enable us then to develop the regulations and be able to go through programming changes that we need to make this transformation happen. In addition, one of the key elements, and this is what we'll start planning for, is workforce planning. We fully appreciate that there is, in this particular sector, there's high turnover. We also fully appreciate that there are some, you know, there can be some challenges in attracting and retention in this sector. So, you know, over the course of the next year, we will be doing some workforce planning and looking at different ways that we can ensure that we can retain, attract, and we have the supply, because in the reality is, and just like in the conversation we were having this morning, in terms of from a healthcare profession standpoint, we know that we need to attract and retain more workers, so there will be a focus on this. And one other last comment that I'll make here is, you know, we appreciate the tremendous work that these healthcare workers have done through COVID. You know, one of the things that our government did in terms of is not only funding to assist continuing care operators to be able to, you know, buy PPE and expand the services to be able to protect the most vulnerable. But we also funded a $2 wage top-up for healthcare workers, and that HCA's healthcare aides, and that's in the previous budget, and we also have funded to continue this in this budget as well.
So much, Minister. Honourable Member.
Yeah, thank you, Madam Chair. So the report indicates 5,500 full-time staff need to be recruited and supported to work in the continuing care system. So that's a significant amount of workers that the government needs to make sure have the supports they need to keep them in that sector. I also wanted just to talk about, certainly the report talks about public versus private, and nonprofit is in there too in terms of the continuing care system, and certainly the outcomes for residents are much better, Madam Chair, through the public and nonprofit system. And so this report is very clear on that, and I just want to make sure that I'm wondering what the government's plan is in terms of funding, new facilities, new spaces? Are they focusing more on the public and nonprofit models because of the much superior outcomes? And we certainly know what the disaster was with the ASLI program, where, really developers became millionaires and seniors and workers got squeezed. We know that through the millions and millions of dollars the Conservative government previously gave to aged care, and they sold their units off in Calgary, many facilities, to a wealth generating company. It's, seniors housing is about generating wealth. It's not about the care of seniors. So that's very disturbing. So I think it's very important that the government be supporting more positive outcomes for seniors, and certainly staff are supported more in those facilities. So I'd just like him to comment on what kind of way the dollars are going to be focused on superior outcomes for seniors in the nonprofit and public sector. Thank you, Madam Chair.
Thank you, Honourable Member. Minister.
I'd like to thank the honourable member for the question. Our government is focused on building capacity within the system broadly. I can tell and share with the honourable member that when we take a look at outbreaks, the outbreaks were, whether it be in there was no differentiation between whether it be private or not-for-profit or public. In fact, when you actually look at the studies, there seems to be a higher correlation between age of the facility and outbreaks, not necessarily the operator, whether it's private, public, or not-for-profit. Quite frankly, our government's focus is actually expanding the capacity and using all potential operators to be able to do that capacity. I very much look forward, and I was very pleased to make the announcement in regards to that we made 2 weeks ago with over 1,500 new beds becoming available based on our RFP that we put out last year, and this is a non-capital ASLI to be able to do that. And with the additional funding, the over $200 million that we're presenting this year, there will be a series of RFPs. And now this is not this includes refurbishment of current existing facilities because they need another influx of cash to be able to get it up to standard. Particularly, as what we saw from the FBCC is a need to move to single bedrooms, not dual occupancy. What we'll also see is RFPs, which actually has gone out already, Madam Chair, through you to the honourable member for Indigenous communities. And that will be closing that and making selections in the near future, and for new facilities in high areas that have been designated in terms of high need. So very much looking forward to putting those RFPs out and getting, quite frankly, more spaces built quickly, because we know there's a demographic that we have an aging population in the province. There are more people who need this, even though our focus is going to try to keep as many as people at home for as long as we can. We are going to need to build more spaces, and it's important that we build these as effectively and as efficiently as possible, because it's all about building as many spaces as we need while ensuring that we maintain the safety of residences and provide the services that they need.
Thank you so much, Minister. That wraps up the official opposition time. We'll head over to the government member side, and I believe we're going to continue on with Member Amory.
Thank you very much, Madam Chair, once again, and thank you to the ministers for the answer. I want to continue on with the Associate Minister, if I could, Madam Chair. I want to talk a little bit about something that was brought up earlier, and that is the partnerships that with the Indigenous communities. I'll direct the Associate Minister to page 18 of the 2022 fiscal plan, where it states that $35.8 million is allocated for Stream 2 of the Recovery Communities Project, which will include a new facility on the Blood Tribe Reserve in support of the government's commitment to transform mental health and addiction systems for Indigenous communities. Minister, you had the opportunity to speak about this earlier, but I am wondering if you will expand on your original answer with respect to the recognition of diversity and culture with respect to delivering mental health and addiction supports and how it all interplays with one another. Thank you.
Thank you, Member. Minister?
Thank you, Chair, and thank you to the member for the question. And as I indicated earlier, friends in the Indigenous community have been disproportionately affected over the years. And this goes back to my time on the Alberta Secretariat for Action on Homelessness. And, there's no one government to blame. I would say that there have been successive governments throughout the course of time on multiple levels that I would argue have not probably done the best job in helping our friends in the Indigenous communities. I myself have taken it between the ministry, myself, working with Minister Wilson to ensure that we are not one of those governments that are going to fail our friends in the Indigenous community. So when they reach out to us about mental health or addictions, and then to your point, Member Amory, our friends in the Blood Tribe who sadly have been terribly and disproportionately affected by the opioid crisis. For those in the room that do not know as well, crystal meth is another drug that is running rampant throughout this province and has disproportionately affected the folks in that community as well. And when we reach out to them and ask them, how can we help you? That's when they obviously wanted to have a treatment center on their reserve to help their people. And let me be, a fantastic group of people. Like, it's not even, when I say their people, they are open, they're inclusive. Anybody who wants treatment, they're going to welcome them onto the reserve in order to help them with the illness of addiction. But the facility that's being built, and I know the ADM is going to
36 million.
36 million, yeah, 36 million to get that thing built. 75 treatment beds. We combine that with in Lethbridge. There's another recovery community that's being built for 50 beds. There we go. Lethbridge 50 beds, Red Deer 75 beds, and of course, that's fantastic for not just central Alberta, but southern Alberta as well. But when we talk to the folks, especially the folks in the Indigenous communities, what they ask is they want to help their people in a path to recovery. They don't want to keep their people in perpetual states of pain and suffering or the cycle of abuse. They want to help them so that they can get help with their illness, so that they can live positive and productive lives. And we're proud of the work that we're doing with our friends in the Indigenous community. We have recovery coaches as an example, Madam Chair. Recovery coaches, as I mentioned earlier, but recovery coaches that are going to come from the Indigenous communities, where they are going to be trained, where they're going to be going into cities such as Lethbridge or Calgary or any other municipality to engage with other community members and let them and show them that there is a life beyond living in the illness of addiction, so that, again, that they can live productive and healthy lives again. So thank you very much, member.
Thank you, Minister. Honourable Member?
Thank you again, Madam Chair. I want to shift a little bit here and now speak or direct my questions to the Minister of Health. The pandemic has undoubtedly disrupted the delivery of many healthcare services for Albertans and has forced governments around the world to rethink how healthcare is delivered. The Minister has been a vocal proponent of alternative delivery methods of healthcare, and it's very simple to focus and try and rely on our traditional brick and mortar type institutions to deliver that healthcare and those services, Madam Chair. But many Albertans were unable or unwilling to leave their homes to access that healthcare even when they needed it throughout the course of the pandemic. As we navigate away from the pandemic and hopefully to a brighter future, I note that there were some positive things that developed as a result. Outcome 1.3, Minister says that the use of digital technology to enable new models of care and reduce manual and paper-based processes is something that the ministry intends or hopes to achieve. During the pandemic, we did see some forms of virtual healthcare, and we saw some alternative types of healthcare delivery. Simply put to the minister, what does this mean going forward?
Thank you, Honourable Member. Minister?
Well, thank you to the honourable member for the question, and the honourable member is quite right, Madam Chair, that during the pandemic, many Albertans stayed at home and quite frankly stayed away from the healthcare system, which prompted our system to consider new and innovative ways of delivering care to Albertans. Among other innovations, virtual care was rapidly adopted by providers to increase Albertans' access to care and to safely deliver care to Albertans in their homes to avoid potential exposure. In addition to increased access, virtual care offered Albertans convenience and flexibility in accessing care services. Now, Alberta Health is working with health system partners on a virtual care strategic policy framework that will ensure that Albertans continue to have access to the virtual care services they have come to rely on. And this strategic policy framework will facilitate the appropriate use and effective integration of virtual care within the provincial healthcare system to achieve the positive benefits of virtual care while minimizing the potential for unintended consequences. For example, siloed care delivery that results in repeatedly collecting patient history and increasing health system costs. And I can say that we moved quite quickly in changing our fee codes to enable doctors to be able to continue, family physicians to be able to continue to see patients virtually, and we adjusted those fee codes because we had actually heard from doctors some concerns in regards to certain codes were not applicable, like complex modifiers in our traditional virtual care code system, and so we added that, particularly going in as we learned our lessons through the fourth wave and going into the fifth wave, we added that to ensure that doctors can continue to see patients and patients can continue to see their doctors, particularly family physicians, and this is all being reviewed in terms of what, as part of our strategic policy framework, but also in terms of our conversation with the AMA about how do we use this going forward, because there's also an opportunity to look at providing services, and we were talking this morning, Member Amory, about leveraging virtual care, particularly where there's shortage of physicians and rural or remote areas, to be able to provide that care, even though there's someone who actually isn't there.
So much, Minister. Honourable Member?
Thank you very much, Minister, and thank you for that response. When we talk about moving quickly to accommodate the type of virtual care that was implemented throughout the pandemic, there are always obvious concerns with moving too quickly. Objective 2.2 states that increase regulations and oversight to improve safety. And while the potential for virtual care obviously has many benefits, there is always the concern that moving too quickly may result in some negative concerns with respect to delivery of care, potentially the proliferation of fraudulent medical care, the lack of the intended effectiveness of that care, and so on. What is your ministry doing to ensure that the care delivered virtually.
Thank you so much,
Is
member.
effective.
And now it goes back over to the official opposition. Please proceed, member.
Thank you, Madam Chair. So I'd like to ask a few questions, I guess, about some of the capital projects that are committed under Budget 22-23. So, of course, there have been a number of announcements and certainly conversation about the commitment for the Red Deer Regional Hospital. So recognizing that we have a commitment here out of the gate of, I believe, about $190 million over 3 years for the redevelopment and expansion of the Red Deer Regional Hospital. So certainly through you to the minister, I recognize the commitment that he's made, and certainly I've been hearing from local healthcare providers in the region that they do appreciate it as well. But certainly what I'm hearing from them, Madam Chair, is a level of skepticism as well, based on the previous promises that were made but not kept. Indeed, in particular, the Premier's promise that there would be shovels in the ground in 2021. So certainly there is a strong desire, I think, amongst healthcare providers in Red Deer to see some concrete details and commitments regarding the timelines for this project. So, so through you to the minister, not needing to go into a lot of detail about what has already been announced, but if you could just clarify, if the minister could clarify, when does he anticipate construction would begin? And if he's unable to say that now, at what point does he believe his government will be able to provide concrete details on the flow of funding and the expected timelines?
Thank you so much, honourable member. Minister.
Thank you so much to the honourable member for the question, and I was very pleased to be in Red Deer to make the announcement of a commitment towards a $1.8 billion total investment for and redevelopment and expansion for the Red Deer Regional Hospital Centre. Budget 2022 includes $193 million over the 3 years, and there has been just to provide some degree of comfort to the honourable member. There's been a significant amount of work that was done, and I thanked the AHS team and the healthcare professionals who actually were involved in developing the budget, and they did significant work through this, through the pandemic, to be able to deliver the budget. You know, we provided resources to be able to assist in that, and it's going to the next phase, which is the functional assessment. So I'll have to speak with my colleague, Minister Panda, in terms of the exact dates of when shovels will be in the ground. But it's, you know, it's important that we actually get, not only to have the budget, that we get do the functional assessment, get that correct, and then we can actually go into letting of the contract and moving forward. But there is a commitment of this government. We have $193 million in the budget over the next 3 years, and our focus is going to be on taking the next step in terms of the functional assessment that we can actually deliver on this project.
Thank you, Chair. I'm going to hand things over to my colleague, MLA Rod Loyola, who I believe has some questions about the South Edmonton Hospital.
Thank you very much, Madam Chair, through you to the Minister. First, I'd just like confirmation on something that I learned from the Minister of Infrastructure, and that is, of course, that around the Cabinet table, it's not necessarily the Minister of Infrastructure that's making decisions on capital plan projects, but instead it is the President of Treasury Board and Minister of Finance. Is this correct, Minister? A yes or no answer will suffice.
So actually, it's a combination. Right, so you know, the assessment, the needs assessment is done by health, and then we work with the Minister of Infrastructure in terms of developing, like, what does the budget look like in terms of be able to do that, and then, you know, once you have a list of all the priorities, that goes to Treasury Board. So it's not the Minister of Finance and the entire Treasury Board that will make the final capital decision in terms of the dollars that are allocated to the various projects.
Thank you very much. Through you, Madam Chair, to the Minister again. So the specific question I have about the South Edmonton Hospital is that will any part of this project be contracted out through alternative financing using the public-private partnership model?
So that's a better question asked to my colleague, the Minister of Infrastructure. You know, we have committed in Budget 2022 and in Health's budget $371 million over 3 years towards a total $930 million total investment with additional funding to be provided in future years as the project planning progresses. My colleague, the Minister of Infrastructure, when they look at, whether or not we can deliver this through, by government, is it delivered through an RFP, or is it
So,
a
Madam
P3?
Chair, through you, then, is it safe to say that you do not know the answer to that question, then, Minister?
Well, I guess my comment is that that's yet to be determined. So my colleague, Minister of Infrastructure, will look at the assessment of what is the best way to deliver a project at that point in time. Now, right now, as you know, that there's ongoing work in terms of servicing
If I may
the
follow
site
up,
and
Madam
their-
Chair, then through you to the Minister. So then, are you involved in any aspect of evaluating then the value of the project, the potential risk to moving to an alternative financing model, and of course, the cost of the project in any way? Is the ministry at all responsible in any way for that evaluation of the process?
So I'll give the high level, and I'll ask Aaron to provide further commentary. But to my understanding, our primary role is the needs assessment. So what do we need to be able to provide health service to Albertans, and then the functional assessment. So what specifically needs to be built, and where does it need to be built to be able to serve the health needs. And then at that point in time, it's a joint decision in regards to cabinet how best to be able to fulfill that. But Aaron, would you like to add further commentary on that? Thanks.
Thank you, Minister. Through the chair to the member. So I believe this was discussed somewhat at infrastructure estimates last week. The government's policy practice is on the infrastructure's website. So any project valued at more than $100 million is subject to an assessment of whether it's there's value for money for delivering it as a P3. So through that process, I would expect Health and AHS to be involved in the assessment.
Okay,
That
Madam Chair,
process
through
led by Ministry of
you, if you don't
Infrastructure.
mind, then that's exactly what I'm after, is like, how are those decisions being made on assessing the value of the project, how you're evaluating the risk by moving it to an alternative financing model? Are you involved in that process, sir?
Through the chair to the member. So when we get to that point, I expect that the Department of Health and the AHS will be involved in that assessment. Probably other ministries as well. But Alberta Infrastructure will lead it. The financial aspects, Treasury Board and Finance folks will probably be involved. And it would be the first major health P3 if we went that route. But, government's done many P3s before, and so there's an established process for evaluating risk, all encompassing.
Okay. Thank you very, please, you can continue then.
Thank you, Chair. Through you to the Minister. Just a follow-up question in the brief time we have in this block. Regarding the Red Deer Hospital, as I reflect further on your answer, you talk about the need for the assessment process of the decisions that can be made before you can make a determination on when construction could begin. Yet last year, we heard that commitment, that promise from the Premier that construction would happen last year, that shovels would be in the ground. So my question, I guess, is did the Premier speak out of hand prematurely without thought, given that there was a significant amount of work that needed to be done before he could make such a promise? Or has there been a significant change in the project that the Premier was speaking of being able to begin last year that necessitates additional work that I assume would have taken place before the Premier made such a commitment?
Thank you so much, Member. Minister?
So thank you to the member for the question. My understanding that part of the answer lies in the delay of the project. Due to COVID, and that impacted a number of our projects, and particularly in terms of Red Deer.
Thank you, Minister. Member?
Okay, thank you. I did want to just ask then regarding the Misericordia Hospital. So certainly with the delay of the Edmonton South Hospital now to 2031, the Misericordia Hospital, as reported by the Edmonton Zone Medical Association, there is a number of situations there that do need to be addressed, and certainly they are carrying alongside the Grey Nuns a considerable amount of the workload for the population growth in the south of Edmonton. So to the best of my awareness, there is no further funding in this budget to address ongoing issues at the Misericordia. Is that something under your consideration at all?
There is, Budget 22 includes $46 million over 2 years to complete this $85 million project. Cash flows have been adjusted to align with project progress. This funding supports the construction of a new standalone emergency department and addresses other high priority maintenance issues at the hospital. And this project, as my understanding, is in the construction phase as we speak, with the completion anticipated in 22-23.
Excellent. Well, in the 25 seconds remaining, I'll just note that ESMA stated in a recent report that they recognize the building of the new emergency room, but they say that is not enough. It currently sees double the number of patients, and notes that an emergency department does not operate in a silo. Other departments do need upgrades. Their ICU has been in a temporary space for years, starting with 10 beds, but only 3 were actually in a room with a door.
So much. Now we'll move over to our independent member, and as soon as we're done this exchange, then we'll have our coffee break. Please proceed, member.
Okay, thank you very much. Through the chair, to the minister. The Red Deer Hospital, I think the Premier announced it, the project to be a $1.8 billion project. But we see in the budget in the next 3 years, I think there's $193 million of that is budgeted to be spent. So there's kind of a big discrepancy between the $193 million and the $1.8 billion announcement. So I guess what I'd like to know is what is the time scale for completion? And, is it going to be a big, long project there? Or what's the time scale to before that $1.8 billion is spent?
Thank you so much, honourable member. Minister.
So thanks to the honourable member for the question. So the budget 22 includes $193 million. That's only the first 3 years of the project. So that will deal primarily with planning and then some renovation pieces of it. This is a multi-year project. Like it will not be completed to 2030. There's one of the challenges of doing a project which is a renovation and adding and an expansion. It will need to be done in phases because this is an operating hospital. So it will take actually longer. There'll be multiple phases as additional tower is added, additional spaces and are added, and you'll actually have to be able to. We have to manage it in such a way that we can continue to operate because this is the regional hospital for the central region in performing surgeries and providing the highest level of care for the central region. So it will take. The $1.8 billion is the budgeted estimate, and that's what took some time. And again, AHS employees and doctors worked very hard on being able to ensure that they got what was in the plan is what they needed, and then we actually had a sound budget number, which is the $1.8 billion over that period of time. And then as we phase this out, it's $193 million for the first 3 years.
Thank you so much, Minister. Member.
Through the chair, did I hear you say 2030?
That's correct. It'll be completely. So through the chair, the question, completion that we announced it is approximately 2030. Now that's the final completion of all the various phases. There will be phases that will be where you'll see pieces of this because it's a project which has multiple elements of it. So you'll see capacity come online in various phases as we go throughout the journey over the next number of years. But final completion, everything done with this $1.8 billion project will be, estimated at 2030.
Thank you so much. Please proceed.
Okay, through the chair. So when will Red Deer Hospital actually have more capacity than it has right now? At what point?
I don't have the project plan in front of me at this point in time, so I'll have to get back to the member on that. I do know that again they are actually phasing this out in multiple phases. So some of it will actually increase capacity within the first I'd have to double check the plan, but 3-4 years in terms of in doing that. And there may be even some rentals that are happening earlier than that. So. But they're working through the first period of time, quite frankly, is going to be the functional assessment to make sure that what we're building is what we need and how we build it, and then they'll go forward with the construction piece of it in phases.
Thank you, Minister. Member.
Okay, thank you very much. That helps a lot. I appreciate that. Okay, now, did you get any of the promised funds for instituting the REP, and if so, which line item is that under? The federal government promised, I think, $1 billion, maybe split up between the provinces for implementing those programs. So I'm wondering if that money has been received, and if so, which line item it would come under.
Thank you, Member. Minister.
I'm just checking.
It's in the revenue. We'll get a CHD transfer. Just give me 1 second.
the revenue transfer. So my understanding is that there was an increase in the Canada Health Transfer in 21-22 for healthcare system pandemic recovery. So helping the healthcare systems recover. But that was a general amount, not for a specific purpose.
Thank you, Minister. Member?
Okay, I guess maybe I'm missing something there, but you know, the Prime Minister had committed to $1 billion. I don't know if it was, at the time I first heard it, I thought it was $1 billion per province that implemented the program, but in afterthought, I realized it may have been $1 billion split up between all the provinces. So I'm just wondering where that money is in the budget, or if it's still coming, or what's happening with that.
Thank you for the question. So we may have to confirm later, but the two numbers that, quite frankly, in the budget are the number that we talked to before, the 116, and then the 465 is that we received in terms of revenue. None of them specific to the REP.
Thank you, Minister. Member?
Okay, thank you. Yeah, if you could undertake that to clarify that, that'd be great. And just one last question here. The capital plan, page 166. There are a number of health capital projects where we see very little adjustment in costs from last year's capital plan to today's capital plan. Projects like the Edmonton Hospital, the Jean Wozdeski Center, the Misericordia Modernization, the Surgical Initiative Capital Program, the Rural Facilities Revitalization Program, and the Rocky View General Hospital. But there are others which do seem to reflect rising costs over last year's targets, like the Peter Lougheed redevelopment and the Lacrete Maternity Center. I just wondered, is there a consistent methodology for these adjustments? I just want to hear if the confidence of last year's targets, if they'll still hold true for these projects going forward with the high rate of inflation that we have right now.
Thank you, Member. Minister?
So I'll start the answer. So generally, there is a standard approach in terms of looking at the cost. Once an initial project is approved based on a needs assessment, then needs to go to budgeting. You may have a less certain number. Once the actual budget is locked in, then there's a much higher degree of certainty. That doesn't mean that it can't change, and especially as you go into the facilities, like the functional programming, then it realizes, well, this changed a little bit. We need actually a little more. Then you have the so each stage gate you go through, there can be a potential change in the budgeting. So it really depends on what stage each of these projects are in. A number of these that you mentioned, like once the budgeting is completed and the functional assessment is done, those numbers are largely locked in, and then you have high degrees of certainty. It's when you're on the earlier end of the planning process where you need to put in a budget number into the plan, but you don't have a high degree of certainty to actually get through the planning process. But Aaron, if you'd like to add for that.
Thank you, Minister. To the member through the chair. We do this on a project by project basis. You're adjusting the cash flows based on progress through the year. And I should caution the member that it's always a bit dangerous to compare this capital plan to last year's capital plan because the fiscal years are not the same. So that is part of the changes that you'll see year over year. So, for example, like Peter Lloyd, you're further along in the projects. So you're starting to get into more than where it might have been more planning money last year that you saw, and now you're doing more construction. So again, we go project by project, and just in terms of cost escalation, it is certainly a concern. Alberta Infrastructure is very carefully monitoring that. You've seen lumber jump up and down, steel jump up and down. So it is a significant concern, and we are monitoring that very carefully.
Thank you so much, sir. Member?
Okay, thank you very much. I think that wraps up my questions today. Appreciate the answers and appreciate your work there too. Thank you very much.
All right, and with that, we will move over to the government side. And
Sorry, were you going to take a break?
Oh, yes, we are going to take a break. Yes, coffee time, 5 minutes. Thank you.
No problem.
has concluded. We'll move over to the government side now. So we are starting with Member Godfrey. Please proceed with your questions.
The minister chance to settle in. Thank you, Madam Chair, and thank you for the opportunity to speak with our minister and ministry officials today. Through you, Madam Chair, I'd first like to thank everyone at the table here and behind the table as well for the incredible work that's been done, I know, through the ministry during this pandemic. And I wanted to just perhaps point out, I've had the distinct pleasure of doing a lot of work and being on a lot of phone calls with ADM Romano. I missed it this morning, unfortunately, but a lot of phone calls with respect to work with the continuing care sector, which I know he's deeply passionate about, and I know the whole table here is deeply passionate about that. But I'm going to turn, Madam Chair, to some questions with respect to EMS service, and we know that EMS service response times have increased and been challenged through this pandemic, we've heard probably more so about this problem acutely in rural and remote communities, both in terms of feedback from our MLAs and certainly from concerns within the community. And wait times have perhaps grown beyond what some Albertans have, I guess, positioned as reasonable expectations for them through this difficult period. So, Madam Chair, on page 53 of the business plan, it indicates that $603 million is budgeted for 2022-2023 for emergency medical EMS services in order to address capacity needs and other pressures on the system, which again we've heard a lot about as new provincial EMS service plan is developed, and that's in support of an effective and accessible healthcare system, and obviously people in critical need of being transported or addressed by the EMS services are certainly a big issue. So I'd like to, through you, Madam Chair, ask the Minister and his colleagues if they can expand on how this funding is going to be used, specifically $603 million, it's a significant commitment, how it's going to be used, how that's going to transform the system, and what we can expect in the coming year or years, as the case may be.
Thank you, Member. Minister?
Thank you, Member Gottfried, for the question. You're quite right. You know, there are, as we spoke about this earlier this morning, but you know, challenges with the EMS system, and we're responding to those challenges. Budget 2022 allocates an additional $64 million in operating funding to strengthen EMS system capacity. So that includes $28 million to add more ground ambulances and crews, in addition to sustainable funding for helicopter and fixed-wing air ambulance services. It includes $22 million to increase capacity to extend ground ambulance contracts and support integrated operations centers and interfacility transport project. And then another further $14 million for the hours of work initiative to address crew fatigue. We are also making progress in implementing a 10-point plan that AHS announced over a month ago to help ensure that the most critical patients receive immediate care. Some of the actions already underway is developing a strategic provincial service plan for EMS delivery, hiring more paramedics, launching pilot projects to manage non-emergency interfacility transfers, initiating an hours of work project to help ease staff fatigue, and one element that is actually already getting traction is changing the approach to calling, particularly in around the big cities, Calgary and Edmonton. There was a concern raised that when there was a shortage in Calgary and Edmonton, there would be we would call from the rural surrounding areas. They'd come into the big city and they'd be trapped there for a period of time. So we change the approach. So for critical calls, obviously the highest level or urgent calls, we will do that. But if it's not urgent, we won't call that in. Or if we do have to call an ambulance in from out of the city, then on their way they're back out, instead of, even though they may be the closest, but if it's a non-critical call, we'll send someone, a city ambulance there to do that. The result is what we've had already is a decrease of by 40% of the amount of time that the ambulances are outside of that rural area. So that's already having an impact. And there's more coming. We'll be creating an integrated operations center in Calgary, implementing a pilot project in Red Deer that will manage patient transfers. And the other key part of this is that we've also, as you know, with some of our members, and Tracy Allard, who's the chair of this ministerial advisory committee that we've appointed, to actually look at the problems. So in addition to the 10-point plan, to be able to look at the entire system, including, and we've had separate tables set up in regards to air ambulance service, in regards to workforce planning. In regards to how do we reduce the amount of time that ambulances are, particularly in big city hospitals, and doing transfers, because we can get them out faster, we'll be able to do that. So I'm looking forward to their report in the spring. But also, you know, we indicated that if they have an idea that the committee agrees on and is going to work, then get that to me quickly and we can act on it sooner. In addition, we have, you know, part of the 64 million is, and we talked about this morning with Member Shepherd, who sort of raised the issue, is in regards to providing, 5 ambulances per year for the 2 big cities, so it's 10 in total over 2 years, 1 for Airdrie, and then and these are 24/7 ambulances that we're talking about. In addition, also adding for a number of sites an additional 12 hours of service over a 7-day period. So, you know, all of this combined, we're actually starting to see the numbers drop. Don't get me wrong, more work needs to be done, and I'm really looking forward to hearing from the Ministerial Advisory Committee over the coming weeks.
Thank you so much, Minister. Member?
Great, thank you, Madam Chair. Thank you to the Minister. You answered some of my next questions here. And it's interesting, you know, when we talk about the air ambulance services and the fact that we have a broadly rural and remote communities, it's some of the work I'm doing with my Strategic Aviation Advisory Council. We're going to have to loop back with your ministry as well, because that discussion, many of our communities across this province are only accessible, or at least seasonally accessible, by air. So it's really important to our medical services. So we look forward, that has been part of that bill as well, and that council. So we look forward to looking forward to finding solutions for that in consultation with your task force as well. I guess my question is what is being done to engage the helicopter operators? You know, it's not something that's available everywhere. There are certain operators around the province. I know that you answered some questions earlier on it. But what are we doing to ensure that we have sustainable service solutions for all parts of the province, including the most rural and remote areas across the province? And how are we going to ensure that we have the resources to address that challenge going forward? Again, through the chair, to you, Minister.
Thank you, Member. Minister?
So thanks again to the honourable member for the question. We currently spend about $55 million a year on air ambulance program, which includes about $8.5 million on provision of helicopter services, and these are split between STARS, Hero, and Halo. And we provide funding for them either on a grant basis or on a fee-for-service basis. We fully appreciate that, you know, our need to engage all of our service providers in this space. And I'll point out again our colleague MLA Allard. We have through this advisory committee, we set up a sub-table, which includes air ambulances, is actually chaired by our colleague member Yao, and which includes, you know, AHS, STARS, Hero, and Halo, to work about how we can improve service in the rural areas of our province. How can we also improve the integration of the dispatch, so we can assure not only that, you know, we send the appropriate number of equipment there, but then also whenever they get there, or sometimes they land in the handoff, there's a ground ambulance that is available if it's not going directly to a particular site, and be able to do the coordination, or in as well as be able to coordinate in terms of paramedics, so we have the right level of paramedics actually on that particular aircraft to be able to provide the service. And there's also some of the tremendous work that these do is that, you know, a combination of search and rescue and then hand off in terms of paramedics. So that's, you know, different in different missions that they're flying, but to make sure that the service is as seamless as possible. And we can do this in a way that is cost effective. Minimize the overlap, but make sure we do that. So these are the type of conversations that are being had at the table and at the sub table. And once again, I'm very much looking forward to hearing their report and how they want to approach this. And we did comment earlier that we need to make sure it's sustainable.
And with that, we will turn the time over to the official opposition. Please proceed, member.
Thank you, Madam Chair. Through you to the Minister, I just wanted to ask some questions, I guess, about lines 2.4, 2.6, and 4.2 in the estimates, specifically in regards to, I guess, the level of deferred care that we know exists as a result of the COVID-19 pandemic. I know that through you to the Minister, we have disagreements over to what extent the government is culpable for that amount of deferred care being better or worse. But I think we would both agree that it is significant. We did see some very high rates of hospitalization through the fourth wave. About 1,128 was the peak. Fifth wave, 1,648. And certainly, I welcome the kinds of investments that are being made in ICU and critical care. We may disagree about approach, but investments in addressing the surgical backlog certainly, I think, are good as well. But what I'm not seeing in this budget is any real investment to address this significant level of deferred care due to the healthcare system being overwhelmed. Line 2.4, acute care, from what I'm seeing, is less than a 1% increase over last year. Line 2.6, diagnostic and therapeutic services, less than 0.5%. And of course, we discussed earlier that we do not see a significant increase in physician services. I've spoken with leaders in internal medicine in Edmonton, folks who've been coordinating hospital care under some enormous pressure, I think, over the last 2 years. They're exhausted. They have been for some time, but their workload is not decreasing. They describe what they're seeing as an avalanche of deferred care, and they believe they are going to continue to see increase in patients that are in need of complex care. And they say they're badly in need of support. For example, last week at the Royal Alex Hospital, they surged to about 130%. Their physician teams are into their 7th week of nonstop work. They're already operating 2 surge teams above their normal baseline. And in their view, through you to the Minister, Madam Chair, the biggest challenge is that they continue to have no additional support to cover patients at night. So we have exhausted physicians caring for 30% more patients, and they have no idea when this pressure is going to release, or if indeed this may be a new normal for some time. So I guess my question to the Minister is, given the lines that I've noted, I am not seeing any significant increase. Why is there, or where are the dollars here for acute care and the level of deferred care?
Thank you so much. Honourable Member, Minister.
So I'd like to thank the honourable member for the question. I would agree with the honourable member that there is a backlog in care. Right, so people have not presented themselves. We talked earlier about the surgical initiative and the numbers that we need to catch up on earlier this morning. So part of that is actually being budgeted as part of the $750 million contingency fund. Right, so that is the COVID contingency fund we're using both to respond to COVID and to actually get through the backlog. We can also so that's on the first point. On the second point, in regards to, and we had this conversation earlier this morning as well, and physician compensation. Again, we've kept the physician compensation largely flat based on what we're what we have been seeing, recognizing that we're still in discussions with the AMA, and then we will make the changes accordingly once we reach an agreement and what that looks like. But then again, even some of the costs associated with additional for additional surgeries and the fees associated with the doctor's fees would actually come out the contingency fund. And the last the last point I'll raise is when we take a look at this budget includes in addition to the $750 million contingency for 22-23, $600 million this year, an additional $600 million next year, an additional $600 million on top of that the year after that. So it's a total of $1.8 billion over a 3-year period. We will continue to do an assessment of what the needs are for Albertans in terms of they'll be able to catch up, and so we can make annual adjustments. But we are mindful of the care deficit. We are budgeting for it in 22-23 primarily through that $750 million, and we're going to be focused on getting caught up on surgeries. As well as reduce wait times for CTR and CT and MRI scans, but really this budget is about building capacity.
Thank you so much, Minister. Member?
Thank you, Madam Chair, and I appreciate that answer from the Minister. And so what I'm hearing is that we're looking at the $750 million contingency fund as, I guess, being the pot from which dollars can be drawn to address deferred care in a number of areas. I do wonder then where we have our transparency and accountability for Albertans. Certainly, we do not have a breakdown, for example, of how dollars from the contingency fund last year were apportioned in different areas. Perhaps it will be something that will come forward as part of future reviews. But what I will say is, I think it's important that we recognize that indeed we want to increase capacity in ICU, we want to increase surgical capacity, but all of those depend on internal medicine and acute care. Increasing surgery, while we'll need more ICU capacity for recovery, when patients leave the ICU, they go into acute care. If we have more ICU, no, pardon me, I guess I just addressed that. So if surgical patients have complications, they can again end up in acute care. And even if when we're talking about EMS and emergency, if we do not have investment in acute care to keep those beds operating and the staff that we need there, then there is nowhere for paramedics to transfer patients. So I think it's extremely important that we see some clarity on that front. In the 4 minutes that we have remaining, I did want to ask one further question on this. Minister, I think you recognize that the important role that physicians play here at various levels, and certainly you've talked about the negotiations you're continuing with the AMA. But at the same time, AHS is pushing forward with discussions and looking at forcing through the Z codes, lower billing codes for physicians providing services in publicly funded facilities, or indeed with overhead charges. There have been discussions around cuts to stipends, and these are indeed continue to create chaos and disruption. I think the minister is aware he had to personally intervene in a situation where we might have actually had a stoppage of work on the part of some physicians involved as hospitalists due to plans for cuts for stipends. So to the minister, I guess, why are you continuing to push these sorts of changes through at a time when the system is still struggling to recover and at a time that you are, in your own words, at the table with the AMA, apparently in good faith?
Thank you so much, Member. Minister?
Thanks to the honourable member for the question, and these are complex pay issues that we're working through with the AMA. In terms of the numbers, like whether it be Z codes or stipends, so for example, certain changes that we've made, that there's been ongoing conversations with the AMA. Some changes have already been made, and that actually were made at the beginning of last year or beginning of this year after consultation with doctors and largely agreed to change the framework. But this is all part of our approach to trying to be able to ensure that not only compensation is fair for our physicians, and our compensation budget is the highest, or almost at the highest it's ever been in the history of the province. So we want to make sure that's fair, but we actually recognize, and I think that a lot of the doctors recognize that we need change. Now, in regards to, we have put off, like where there was an issue of concern as we were migrating from one system to another, whether it be for example, stipends, and we were migrating to a different form of payment. We have actually put that, we've paused that at this point in time. To be able to make those changes so that we can talk about it at the table, or give more time for ongoing conversations between the parties, so we can, because really this is all about not necessarily paying less, but having a simpler method of pay, where the work is recognized, and we can move to perhaps other forms of pay, like alternative, like ARPs, alternative systems of pay, because one of the challenges that we have, and this is what we're dealing at the main table with the doctors, is that our fee for service as it's currently structured doesn't work in all instances. We actually need to change it. We need to compensate doctors fairly, while at the same time ensuring we have a fiscally sustainable system, and we incent the behaviors that we need and want to be able to drive better outcomes for Albertans. So we have delayed a number of implementation, some issues while we're working through with conversations with the doctors. And my understanding is that there's good conversations being had at the table, and I'm looking forward to completing those, and I'm hopeful that we'll be able to get an agreement.
Thank you, Minister.
Thank you, Madam Chair. And the
And
25,
if I
20
may,
or
in the
so
last
seconds
25
remaining.
seconds,
What's that?
there was a question asked by the honourable member earlier this
Sure,
morning, if I
absolutely.
could just provide some details. So some questions were asked about additional FTEs for paramedics. So under $16 million is new activity, that's 92 FTEs, 44 advanced care paramedics, 44 primary care paramedics, and 4 supervisors.
Thank you so much, Minister. And now the time goes over to our independent member, Mr. Lowen. I just gave you promotion.
All right.
Please proceed.
Okay, thank you very much, and thanks again, Minister. My questions now, some of them are maybe more comments and questions, but I'd like to have some of your input on them anyways. Presently, the system for booking a lab time to have lab work done, normally in the past, the process was you'd go see your doctor would contact the lab, and you would just, in a small rural hospital, you just walk over to the lab, get your lab work done and go home. But now the process is that people have to actually call and book appointment for the lab that's literally 20 paces away from the doctor that they're seeing right now. So I'm wondering if there's a simpler process we could use that might streamline and make that system a little more efficient, especially in rural Alberta where the labs are literally right there and the people just right there too. So.
Thank you, Member. Minister.
Well, I thank the honourable member for the question in terms of the lab work. I can't talk, at the system level, right? We and not in terms of the specific processes, but at the system level, we are making some changes to be able to provide better service to Albertans while at the same time as managing costs. So, for example, the Dynalife contract, we did an RFP and have Dynalife that will be able to take over much of our lab services outside of our hospitals. They were doing work already in northern Alberta, and now they'll be able to be doing that in southern Alberta. We're doing that for a number of reasons. One is to be able to drive economies of scales and actually drive down costs, but also to improve service to Albertans. In terms of the specific questions that you're asking, in terms of walk up versus bookings, I can't get into that level of detail in terms of whether that's a process change, or whether that was more related in terms of dealing with bookings, or whether there's availability in terms of that. So I don't have that level of detail, but from our government's focus is really about and this is a prime example is how do we provide the same level or better service for Albertans while at the same time managing our costs. Because quite frankly, we look at the demographics that are coming at us, and we had this conversation earlier this morning. Our population is getting older. They'll be using more services and a huge demand, and we cannot continue to be on a 5 to 6% increase every year in terms of our health spending, but we still need to provide the service. So it's looking at other avenues, so in terms of process improvements, in terms of looking at, can we actually leverage the volume, the increased volume that we're having, so that, we can reduce our cost per unit, so that instead of a 5% increase, we can get that down to a 2 to 3% increase a year. Now, we have been successful over the last few years, and we can continue to drive that, but at the end of the day, what's critically important is we provide the service, and all the savings, we talk about, Dynalife in terms of the savings that we'll be generating from moving into that contract will go back into the healthcare system to, quite frankly, provide more tests. So I can't speak to your specific example, but I can tell you that, we are looking at all aspects of our healthcare and how do we, manage it on a cost per unit basis, but also to be able to provide, the same or better service, while at the same time reinvesting in our healthcare system.
Thank you, Minister. Member.
Yes, thank you very much. And and I guess just kind of looking from the outside, of course, you and your staff would have a better idea, the internal workings of that. But just looking from the outside, it's kind of interesting that before you just walk over to the lab, get it done, and now you have to call somebody in another city to book the appointment at the lab that's right there. So it almost seems like there's an extra step, but maybe there's some sort of savings that I'm not seeing there. But anyways, that was the issue there. Another concern I've had, and you may have covered some of this earlier today too, but when we have obviously for some reason we can't graduate enough doctors here in Alberta to serve our needs, so we have to bring doctors in, and that licensing, that process to get doctors approved to work here from other countries that are educated in other countries has been a problem as far as getting people here in a timely manner. But I'll leave that because I think we've maybe had that discussion before already as far as that process and why it takes so long. But we do have the other issue where we have Albertan residents, people born and raised in Alberta, that couldn't get into the universities here to become a doctor, have went to Europe, to England or something, and got that education and now want to come back. And it's substantially easier for them to just stay in England and work, or to go to the US and work, rather than come back to Alberta and work. And obviously some of these people that I know are want to come back to rural Alberta where they were born and raised, and they want to work here, but the process is a couple-year process for that to happen. So and maybe I'll just have you maybe comment on that and see what we're doing to see if we can alleviate that long time frame and be able to get those people back working here in Alberta.
Thank you, Member. Minister?
Well, thank you, Member Lone, for the question, and this issue was also raised this morning by another of our MLA colleagues. We are fully understand that going back to the Fair Registration Practices Act that our government passed early on when I wore a different hat as member of Labor and Immigration. The focus of that act was actually to be able to start standardizing the process for recognition of foreign credentials, and to not only standardize it, but make sure that there was an answer that would be provided within 6 months of here's what you need to do to get that. And that quite frankly was the first step. We fully appreciate, and especially being in health with the challenge of recruiting and retaining healthcare professionals. Now the numbers continue to go up. So doctors continue to go up. We have more nurses than we've ever had. We have more doctors in the province, and it goes up every year. But they're not necessarily all in the right locations, and they're not necessarily in all the right specialties, right? So family docs, and we had a long conversation about anesthetists or anesthesiologists earlier this morning. But what I can say is that one of the the challenges I've thrown out to the colleges, which is yes, your job is to protect the safety of Albertans, and that's critically important. But that also includes you need to ensure that we have safe supply. Right, we need the people here, so that how can we speed up the processes? So I've already had conversations with my colleagues in Labor and Immigration and the Associate Minister for Immigration and Multiculturalism to work together, and with the colleges to say, how can we speed up the process? And it's not only that; and I mentioned this earlier today. It's about our new rural renewal stream that we announced, which actually reaches through. It's Alberta stream, but it actually reaches through the express entry stream that the federal government has. But then working with the federal government to be able to pick the individuals who are the closest to being able to certify. Because, and I look at it from an HR perspective, when you're hiring someone, right, you want to hire someone who's closest to be able to fit the job as quickly as you can. And if someone isn't readily qualified, then what's the shortest period of time I can do that? So this work is ongoing. We are leveraging international trained medical graduates significantly, like 40% of all the applications for IMGs in the country happen here in Alberta. So now we've been impacted in part by COVID in terms of the supply that's coming in, but we are leveraging it heavily as a medium-term strategy to be able to increase supply of doctors and healthcare professionals. But we will be doing more work in leveraging quite frankly, the legislation that we've already passed. To be able to work with the colleges to say, okay, how do we speed this up? Because we need people, and quite frankly, we need people now, including particularly doctors in rural areas, family doctors, and then, as we discussed earlier today, anesthesiologists, which are in short supply.
Thank you so much, Minister. Member?
Yes, thank you, and thank you for that. Appreciate. Just going to cover, well, maybe at least one, maybe two more topics. But anyways, this one's maybe a little bit more individual. But the facility that had issues early on in COVID, Manoir de Lac and McLennan, it's been having some troubles, I guess, dealing with the issues of with AHS kind of taking that over and kind of issues with the management of it and so I just wanted to know what where we're at with that. And I think you met with the community there already, and just wondered if there's any resolution to that situation yet. That so this facility can be up and operating in hands that own it, I guess.
Thank you, Member Minister.
So thanks to the honourable member for the question. So this is a challenging situation. You know, we and AHS sort of steps in as a provider of last resort when there is a need, and really their first and most important priority is to ensure a safe and uninterrupted care to clients, and in particular, including those at Manoir de Lac.
Thank you, Minister. And our time now moves over to the government side. Please proceed, Member.
Thank you, Madam Chair, and thank you again for the time here today. Through you, Madam Chair, to the Minister, I just wanted to shift gears here and talk a little bit about physician compensation. On page 120 of the government estimates, the line item physician compensation development is held relatively even over the next few years at about $5.5 billion, give or take a few $1 million, of course, along the way, so fairly stable funding. And, you know, through that, I'm seeing that there's obviously, you know, what we're hearing, and I think it's well recognized by Albertans, that stability in our healthcare system is really the objective, and that instability doesn't serve Albertans or all of our constituents generally, and that they think that they want to see a fair deal in place for physicians. And of course, we're now moving towards, as was noted, I think in Objective 2.1, notes that working with the Alberta Medical Association to reach a fiscally sustainable agreement, and on page 127 of the government's fiscal plan discusses negotiations with the AMA, the Alberta Medical Association. So I think what I'd like to hear a little bit about from you is what that path looks like going forward, how the negotiations with the Medical Association, which seem to be underway, how those are going, and noting that our Alberta doctors are, I think, competitively compensated relative to other provinces. We've heard that, and certainly that's been shared with us. Will this flat budgeting going forward be enough for you to establish a fair deal, to ensure that we have the stability of physician services in Alberta? And I'd also welcome any comments you have. I know there's lots of talk around nurse practitioners also within this realm as well. So maybe there's some references there that might be relevant to the discussion on those discussions and those negotiations as well.
Thank you so much, Member. Minister.
Thank you, Chair, and thank you to the member for the question. First, I'll just deal with the budgeting issue, and you know, the 5.5 billion hasn't changed markedly. One of the reasons for that is you don't know what you don't know. So we are in discussions. We don't know what the outcome of those discussions will be. So all we can do is plan for what we do. You know, what we do know is what was last year's budget, and then we'll plan for that. That's not to say that you know, that's what the only the budgeted amount that is there. So we just, you know, that's all we can do. And I'll give another example is that, for example, when we were, you know, you'll see an increase in this budget to reflect the new agreement with UNA, right, which has increased. And you know, if you looked at last year's budget and you went through our multi-year plan, you wouldn't have seen that because we didn't actually have an agreement. So it's important to note that that's why the budget is budget number way it is. Now, I am optimistic that we will reach an agreement with the AMA. we have taken a step back and we've entered into a different form of bargaining. It's called interest-based bargaining. And the purpose for that is quite frankly is because putting it's traditional position-based bargaining where you put a number on the table here. I want a -2, and then no, I want a +10 or whatever that is, and then you work towards the middle. One of the challenges associated with that is that it doesn't get behind what the positions are and why, and it doesn't help you solve the problems. And interest-based bargaining is a process by which you identify the interests of the parties. So, and there's so many shared interests because when we look at the doctors and we look at Alberta Health and we look at all of our healthcare practitioners, we are the system. We all want to ensure that there's a provision of high quality health services to Albertans, that we all want to ensure that they have access to that. We all want to ensure that it's fiscally sustainable over the long term. We all want to ensure that we can actually physicians are paid fairly and we can attract and retain them. Everybody agrees with that. Now the question is how best to accomplish that. And it's better to do that by joint problem solving, which is what interest-based bargaining is, as opposed to just throwing positions on the table back and forth. So we have engaged in that. We started in January with a mediator sort of leading that process. The parties are at the table. I am hopeful that we can actually get through to an agreement towards the spring. Or end of the spring as we move forward in conversations. Again, my own history. I used to do this for a living, so it's really hard for me not to be really involved in this. But my understanding is that the conversations are ongoing, and I'm very much looking forward to the solutions that they propose because we have so many common interests. We need to work together on this to be able to solve these problems. Because quite frankly, you take a look at our healthcare system. It's AHS, it's Alberta Health. It's the doctors, it's the nurses, it's all the people who work in it, and by doing it on an interest base, recognizing that we have to solve these problems together because this is our system, and quite frankly, we need to deliver for Albertans.
Thank you, Mr. Member.
Thank you to the Minister through the Chair, and I'll cede the rest of my time to Emily Smith.
Thank you, Madam Chair. And through you to the Minister, I just want to start by saying thank you. I'm not sure that over the last 2.5 years there's anybody in this government that has had a harder job than you and your ministry, and so I just want to say thank you for all the hard work you've done. I want to start by referring to the fiscal plan and through the chair to you, Minister, referring to page 201 in the COVID recovery plan. The government has decided to maintain masking requirements on public and intra-provincial transit. And can you explain the rationale for lifting masking requirements virtually everywhere, including in higher risk situations like high attendance sporting events? But you've maintained masking on transit. So could you explain the rationale behind that, please?
Thank you, Member. Minister.
Thank you so much to the honourable member for the question. And I'm happy to provide a sort of a high-level response, and then I'll ask Dr. Hinshaw to weigh in on this particular question. So at a high level, there's a recognition that in certain high-risk settings, so like hospitals, like continuing care settings, that masking is a prudent way to be able to minimize the spread and protect those who are most vulnerable. And then when we talk about municipal transit, the decision was made recognizing that you have there are Albertans who are taking municipal transit who need to go to work, who have no other means of may have no other means of transit, need to take that or need to take that to go see a doctor, have no other means to do that, and maybe high-risk individuals as well. So as when we did our 3-stage reduction, that's the last stage to do that, and so we recognize that the masks do provide some level of protection, and we're trying to protect the most vulnerable. But with that, I'd ask maybe Dr. Hinshaw if you can comment further on this.
Thank you. And Dr. Jeannie Hinshaw, Chief Medical Officer of Health. Just to reiterate what the Minister has said about the importance of ensuring that protection remains, we know that although the impacts of COVID are reducing, we still see our positivity rates sitting around 20%, which is about double the previous peak of positivity rates in previous waves. We still have around 1,000 patients in hospital when you look at the combined ICU and non-ICU beds, and the risk does remain high for those Albertans who have risk factors. For those who don't have the protection of vaccines, severe outcomes are still a high likelihood. And so again, as the Minister has mentioned, in places like transit, where individuals may not have other options to attend essential services or appointments, the requirement for masking provides an extra layer of protection for individuals who are needing to use that service.
Thank you. Please proceed, member.
Thank you, Madam Chair. And through you to the Minister, the approach to lifting public health measures announced on February the 8th, 2022 has been criticized in some corners as rushed. It is evident, however, that virtually every jurisdiction across North America and the world is taking the same approach that Alberta did, and in some cases even earlier and faster. And I think I can speak for many of my constituents as saying they wanted to move it faster. Can you please elaborate on how the government arrived at the decision to lift restrictions and whether Alberta was an outlier in doing so?
Thank you, member. Minister.
Well, thank you for the question. The decision to begin lifting public health measures announced on February 8th came at a time when we were seeing very clear signs that the fifth wave had peaked and, quite frankly, was receding. The rate of new hospitalizations and
So much, Minister. I will move now over to the official opposition. Please proceed, Honourable Member.
I want to take the opportunity to, ask the Minister some questions. Under Allied Health Services on line 9 of the estimates, and then also under Outcome 1 on the business plan on effective, accessible, and coordinated healthcare system built around the needs of individuals, families, caregivers, communities, supported by competent, accountable health professionals. Now, there have been some significant changes to access to physiotherapy in the province of Alberta that were enacted somewhat quietly, it seems, as of March 1st. Prior to March 1st, any Albertan with a valid health care card could get coverage for 1 physio assessment and 2 follow-up treatments. But as of March 1st, the province no longer covers that. There are only 2 exceptions where the province will cover physiotherapy services. That's after surgery, but only for orthopedic knee hip replacements. In that case, they will offer 4 sessions compared to the previous 7. And then for low-income Albertans, my understanding is those under $26,000 of annual income for 1 person and $42,000 for a couple. So these are very significant changes to what is essentially a very important treatment, and one I think that is important in preventing other costs in the healthcare system, folks having to access acute care, hospital emergency. So through you, Chair, to the Minister, if you could clarify, how much is he projecting that will be saved by making this significant change? And can he clarify how this decision was made? Were there any discussions with the frontline care providers about the potential impact of effectively nearly delisting a significant amount of physiotherapy treatment?
Thank you, member. Minister.
Thank you to the honourable member for the chair. I'm going to have to actually get back to you on physiotherapy in regards to the suggestion that we've delisted the services, and I'll be able to we can focus on that at another time. But I'm going to have to get back to you on that because I in terms of conversation with staff in terms of delisting, I'm not seeing that. But if you believe that we actually have done that, then I'm going to have to actually double check that.
Well, Chair, if I may, through you to the Minister, perhaps let's set aside that particular term if we disagree on its use. But are you aware, Minister, that there has been a significant change in the access to the service? And who is able to access the criteria? In fact, I mean, there was an RFP process that went forward to determine which physiotherapists would carry this out. There is a rehabilitation advice line that Albertans have to go through now in order to determine whether they can access those services. Are you really, as Minister, not aware that these changes have taken place?
Thank you, member. Minister.
Well, thanks to the honourable member for the question. My understanding that some of these changes may have taken place within AHS, so I'll have to get back to the honourable member in terms of the details.
Thank you, Minister. Member?
Okay, well, thank you, Madam Chair, and I guess perhaps it shouldn't be surprising. I know I found it very difficult myself doing some basic searches online to even find any of this information about how this process works, what this procedure is, and how it would be going forward. I can only imagine what it's like for Albertans who are caught in this situation. Indeed, I heard from one Alberta family whose son, 33 years old, adult son, lost his physiotherapy coverage recently. He's on AISH. He has myotonic dystrophy. So it's a muscle wasting disease. So if he doesn't work his muscles, he loses them. So he's been losing his ability to use his hands, feet, arms, legs. He's been going to physio on a weekly basis since January 2022, lives in a rural area. It took him a while to find a clinic. And he was contacted by his physiotherapist who told him he's no longer able to bill, and because of this change to physiotherapy coverage. This gentleman called the rehabilitation line and was told that he no longer qualifies for coverage. His condition is considered neurological rather than muscular. So this is a concern. I mean, it's a gentleman on AISH, and again, these changes are having a very real impact on Albertans. So I look forward to a follow-up from the minister on that. I will move over then to perhaps some comments about concerns that have been brought forward to me by speech-language pathologists under the same part of the business plan. I'm talking about allied health services. Now, I did have, throughout the course of the pandemic, speech-language pathologists who reached out to me about concerns as they were redeployed to be line handlers and other things that happened repeatedly. My understanding is they were called back to do testing in September 2021 because the government waited until 4 days prior to renewing contracts of newly hired swabbing staff. So as a result of many decisions of the government, we have a significant backlog of care that's needed, I think, for speech-language pathologists to working with youth that are in need. Very long assessment wait lists, what they describe to me as crazy long treatment lists in the Edmonton zone and other areas. Some kids who were referred in 2020 who have not yet been seen for treatment. A wait list of up to 4 months. That's normally 1 month. And the Central Zone having to take on some Edmonton treatment clinics for virtual services given those long wait times. So with this extensive wait list, now certainly again I'd note that speech-language pathologists are currently being targeted and bargaining for a wage cut of about 9%. So through you to the minister, I don't see how this was cost effective in some respects to have delayed, I guess, on some of the decisions they made on the staffing that was needed for swabbing, et cetera. But is there any additional funding in this budget to address this significant level of deferred care for children, youth, and others, indeed speech-language pathologists, dealing with, also do deal with in medical situations with individuals who have trouble swallowing. And I've seen some some reporting that as many as 30% of their caseload is post-COVID, long COVID patients struggling with swallowing issues. So could the minister perhaps speak to that and what steps he's taking to address this issue in this budget?
Thank you so much, Honourable Member. Minister?
Thank you to the honourable member for the question. So in regards to speech pathologists, these are, as I understand it, are employees of AHS. So in terms of we have increased AHS's budget to be able to meet demand. The total budget increase is $475 million to AHS. So and they have some flexibility to be able to use those dollars as they see fit. But in addition, I may actually just add my colleague Minister Ellis to talk about an initiative that he's doing, which may assist in this regard.
Yeah, thank you very much, and thank you to the member and the minister. I'm working very closely with the Children's Services as well as education. There are a number of great organizations such as CASA up here in Edmonton, as well as ISSP. For those who don't know what that stands for, it's the Integrated School Support Program. A pilot project that was started several years ago, actually, even when I was a police officer, so several years ago. But what it aims to do is to really provide that comprehensive service for children. So to understand that the school is essentially the hub for not only the child, but the family. So in that hub, you would have comprehensive services such as psychological services, such as nutrition, such as
To the Associate Minister, I appreciate those thoughts, but I am asking specifically here about the medical service within the medical system. We're not at education estimates, and I wasn't asking about psychological issues. But if that's what we have to offer there, I'll move to one other question.
15 million.
Perhaps I'll just move to an additional question then, if that's as much as we have on the medical side of things. What I would ask about then is, just in terms of long COVID supports, I'm aware that we have a couple of clinics set up in Alberta, but I just want to ask the Minister, at present, those clinics will only accept adult patients. I've spoken with parents of kids who are living with long COVID, some for as long as almost 2 years, and they have no additional supports and services through AHS. Has the Minister given any consideration, had any discussions with his department or AHS about funding for supports for kids with long COVID?
Thank you so much, Honourable Member. Minister.
So thank you to the honourable member for the question. The honourable member is quite right. We actually we are working in terms of we recognize long COVID is a challenge for some people who have had COVID and are suffering from long COVID. AHS, quite frankly, estimates that 20% of Albertans with COVID-19 may have developed long COVID. So they have established a number of centers, one in Edmonton at the K Edmonton Clinic, and in Calgary at the Peter Lougheed Center, also at the Rocky View in Calgary in the Edmonton North.
Thank you so much. That concludes our time, and we move now back over to the government side. Please proceed, Honourable Member.
Thank you, Madam Chair. And through you to the Minister, we were sort of cut off there at the end there. We were talking a little bit about, in our last set of questions, about the government lifting restrictions. I know that in my constituency, my constituents were begging us to lift restrictions, but I know that there were areas and segments of the Alberta society where they were very hesitant to lift the restrictions. And so my question to you again, just so to remind you, was can you please elaborate on how the government arrived at the decision to lift restrictions and whether Alberta is an outlier in doing so?
Thank you so much, Honourable Member. Minister.
Thanks again to the honourable member for the question. So, as I indicated earlier, when we made the decision, it came at a time we were seeing very clear evidence of that we were on the downside of the fifth wave. Rate of new hospitalizations and rolling 7-day average positivity rate had dropped steadily across the province. Leading indicators, including wastewater surveillance, was dropping, and so we actually, we took a step that we'd seen being taken in a number of other countries, particularly in Europe, in terms of removal of restrictions and removal of a significant number of restrictions, and so that's why we actually developed our three-stage plan. So starting with the REP and masking on children, and then moving to almost all restrictions in stage 2, which we did earlier this month, and then the last phase is just protecting those individuals as we talked earlier in high risk settings. And this was in line after we had done some assessment of other countries that have took a similar approach. We take a look at the UK, and not only UK, but Britain and Ireland, a number of European countries where we've seen when they actually made those reductions, they still saw a continued decrease and there may have been a slight plateau, but then it continued to drop down in terms of cases, but an ongoing decrease in terms of hospitalizations, which so based on that, we have confidence in terms of the decision that we made in terms of the stage approach, and also by doing the stage approach, what it enabled us to do is able to watch when we make the first change, give it 3 weeks to see it work through the system, to see if we did have a bump in cases. And quite frankly, since we've made the announcements and since we've hit the peak of the wave, new hospitalizations continue to go down. Our case counts continue to go down, and wastewater, even to this day, we can trend downward or has been stable. So when we take a look at this in terms of making the decision at that point in time, and we look in the rearview mirror, not only about what other jurisdictions did, but what we did, and based on our own data, we made the right call.
looking at page, and through you to the Minister, looking at page 114 in the government's estimates, specifically element 8.2, immunization support, I'm wondering how many doses of influenza vaccine Alberta purchases on an annual basis, and what is the uptake for influenza vaccines? And we have seen vocal opposition and vocal hesitancy to the COVID vaccine by many Albertans across this province. Is there a similar level of hesitancy and opposition to the influenza vaccine? Thank you.
Thank you, Honourable Member. Minister?
Well, thanks to the honourable member for the question. So, and the first question that you're talking about in terms of, element 8.2, how many doses of influenza vaccine does Alberta purchase on an annual basis? For the 21-22 season, over 2.1 million doses of vaccine were purchased, enough for approximately 45% of the population. And reducing the influenza vaccine purchase from 45% to 35 to 40% of the population should meet the demand to minimize vaccine wastage. As you may recall, 2 years ago we had the highest level of uptake in terms of influenza vaccine. So we actually purchased again to be able to meet that for last budget year. Not as many people took the vaccine for the last budget year. We didn't have as much of an uptake. Now, I don't know if that had to do with the lack of availability of COVID vaccines 2 years ago, right? In terms of that, and people actually getting themselves injected, because that's what with the influenza vaccine doing that, and then now that we had COVID vaccine, sort of the last fall. There was a decrease. From our government standpoint, is we know that vaccines provide protection, and provide protection not only for Albertans but for our healthcare system. And so we urge all Albertans to get the COVID vaccine, get the boosters, but also to be able to get the flu vaccine, because even within within our system. So as we start moving into what I call it a period of more normalcy, right, where people are interacting on a regular basis. We saw over the last couple of years the amount of flu, even though it was still circulating, but it was at incredibly low levels, and the people are actually in our hospitals, where typically in a bad flu year you would have 500 in non-ICU. That we haven't seen those numbers or anywhere near those numbers over the last couple of years, given the measures we put in place. So, recognizing we're moving to a more normal period where you're going to have flu vaccine, so particularly the next flu season next year, there'll be more circulating. So we're going to continue to, purchase flu vaccines, which is actually in our budget, to be able to urge Albertans to get the vaccine, and then and to normalize also COVID boosters, because there will be another wave, and so one thing we'll be moving towards is get your flu vaccine and get your COVID shot, and we'll have to actually work through with the Chief Medical Officer of Health, whether that's a COVID vaccine every 6 months, or does it become an annual shot. But we'll have to wait and see how we do that. But our focus is actually on supporting both of them as we move into the future, to be able to again protect the most vulnerable of Albertans and protect our healthcare system.
Thank you, Minister. Member?
Thank you, Madam Chair, and through you to the Minister. Minister, can you provide the specifics around the increase of 10.6 million to element 13.2 IT development and operations on page 113 of the government estimates? How does the Alberta vaccine booking system support Alberta's response to COVID-19 and to other variants?
Thank you, Member. Minister?
Yeah, thank you to the honourable member for the question. So the increase relates primarily to 22.6 million allocated to element 13.2 to operate the Alberta vaccine booking system. Now, this system will provide various benefits, such as providing one point of access to book vaccine appointments, record citizens who are interested in receiving the vaccine, and providing real-time data, including analytics and reports. Now, the system was brought online in fiscal 21-22 to assist with the COVID-19 vaccine deployment, and costs in 21-22 were covered by the COVID-19 contingency fund. This increase was partially offset by a $12 million decrease related to the virtual care priorities funding received from Health Canada in fiscal 21-22.
Thank you, Minister. Member?
Thank you. And I have one last question through you to the minister. I've heard that in the news that Albertans affected by long COVID, while many who are single or double and even triple vaccinated are lucky, that in the event that they do get COVID, the symptoms remain mild, and it is a mere inconvenience than a major health event, for instance. However, there are still cases of those who are hit hard and experience lasting effects. These cases should not be overlooked. Looking at the significant increases in health's budget as shown on page 120 of the government 2022-23 estimates, does the government know how many Albertans will be affected by long COVID, and is it budgeted for? And what are the government's plans to address long COVID? Thank you.
Thank you. Member Minister.
Thank you to the honourable member for the question. I sort of, as I was responding to Member Shepherd, sort of touched on this in my answer as well. But, long COVID is an issue, and it's affecting Albertans. In terms of our government response, we have established specialized referral clinics for long COVID in Alberta. In Edmonton, as I mentioned, the K Edmonton Clinic and the Edmonton North PCN, and in Calgary, it's the Peter Lougheed and the Rockview General Hospital. And AHS is establishing rehabilitation services, including physical therapy and occupational therapy, to address. Alberta Health is also undertaking a post-COVID follow-up study to better understand the effects of COVID-19 pandemic on Albertans' physical and psychological health. So that study started, on October the 4th, and 21. 40,000 letters were mailed to invite individuals who had a PCR COVID-19 test between March 2020 and June 21 to participate in the survey study. And on January 15th, a website was established for any Albertans who took a COVID-19 test to participate in the survey study. And preliminary results are under analysis as the study continues, and we'll be able to talk more about this.
Thank you so much, Minister. Now we go over to the official opposition. Please proceed, Member.
Thank you, Madam Chair. Through you to the Minister, perhaps we'll give him an opportunity then just to build on the answer he was just providing to MLA Smith and just to address the last bit of the question that I had asked regarding building, I guess, some long COVID supports that are specifically available to youth. And if you'd also like then to finish, I guess, the update he was providing on paramedic numbers.
Thank you, Honourable Member. Minister.
Thanks to the honourable member so I'll finish the in terms of our response in regards to dealing with long COVID, and just to let members know that resources for the public have been developed and posted by Alberta Health on myhealth.alberta.ca website and by AHS on the Together for Health website. And we're continuing to monitor the evidence on long COVID and continue to update guidance and recommendation, and encourage Albertans to get immunized in this regard, because that can help protect Albertans not only from COVID but also from long COVID. In regards to the question in terms of I had not heard that this access by children was not permitted at these sites, so I'll undertake to MLA Shepherd to be able to look into that issue and see if we can actually we can address that, and then what services are provided to children who are actually suffering from long COVID. I also have further information to provide to Member Shepherd from questions that were asked this morning. We started talking about in a response to another question, we started talking about additional full-time paramedics associated with the new funding. I did talk about the new activity, $60 million, and that was in regards to the new ambulances. But I just want to highlight that when we talk about the additional $64 million, right, there also is full-time equivalents, 185 associated with that. And these are all estimates at this point in time, but include 62 advanced care paramedic, 94 primary care paramedics, 9 emergency communication officers, and 20 supervisors. Now, these FTEs, just for background, do not include increases for contract EMS providers. So if we're contracting, we haven't included those numbers. These are AHS employees, and the total are included in the 850 FTE increase reported for AHS on page 212 of the fiscal plan. So numbers in AHS are increasing. The last comment I'd actually like to talk to, we had a conversation in regards to anesthesiologists So a question was, how many do we actually have in the province? And then, what numbers to be able to serve the plan, what numbers would we need? So, ballpark, we have 460. That's the count as of today, but it fluctuates in terms of across the province. When we use the current model, and this is, we had a conversation in regards to, on the current model and based on the productivity, you may not need as many, but based on the current productivity, and we look over the course of the next 3 years, we're going to need approximately about a 5% increase in that number each year to be able to do that. But I can tell the honourable member that one of the key areas of focus and part of the objectives of the Alberta Surgical Initiative is to increase the efficiency in performing the surgeries, and so if we can get quite frankly, if we get a 15% increase in efficiencies, then the number of anesthesiologists that we'll need will actually be zero, right? But we're that work is ongoing, and it also doesn't comment on the fact is that quite frankly, we need them in the right places. So as you indicated, we are currently hiring for, or we spoke about, we're currently hiring for in Red Deer right now to be able to do that, and we are, as I mentioned, the short, medium, long-term plan to be able to get more anesthesiologists in the province.
Minister, thank you. I appreciate getting some of the specific numbers, and I appreciate the substantive information that you've been able to provide at times today. Thank you for that. I do appreciate being able to engage in that dialogue. Along a similar vein, I had an exchange with the minister in the House regarding the operational funding for the Calgary Cancer Centre. So at present, I do not see in this budget any funding for the actual operation of the Calgary Cancer Centre. Certainly, what I did hear the minister refer to in question period was that a reference to staff that would be transferring from the foothills over to that facility. So on the Calgary Cancer Centre, to the minister, what percentage of the staff, I guess, would the staff needed would be coming from the foothills? How many additional staff do you anticipate needing? And are those costs, in fact, listed or anticipated in this budget, or does he have some other means by which he intends to fund those staff?
Thank you, Member. Minister?
Well, thanks the honourable member for the question. So I don't have the exact details associated with the numbers, the actual numbers of staff that are coming over. At a very high level, my understanding is that the vast majority of the staff will be transferring over to from the Tom Baker to the Calgary Cancer Centre. I can't say 100% with absolute certainty, because there may be some programs that will be left at the Tom Baker. But I think that's a very, very small amount. And then, of course, to the honourable member, when we built the Calgary Cancer Centre, we built for growth, right? So not necessarily all of the facilities will be used on day one 100%. There is additional capacity in there for growth, but we are committed to be able to, and this goes part to, again, to the $600 million additional dollars for funding for health, and a large portion of that is into AHS. Their budgets are going up as well. So that part of that, and that $600 million is each and every year. So it's a by the time you get 3 years out, it's an additional $1.8 billion to our overall budget. So we're looking to fund projects such as the Calgary Cancer Centre, and then be able to deal with the increased growth as required.
Minister, thank you.
Thank you, Madam Chair. Through you to the Minister. Thank you for that clarification. That's much appreciated. If I could ask, just again, speaking about line 4.3 in the budget, talking about physicians and particularly education and recruitment. As I mentioned earlier, and I know the Minister is aware because my colleague from the Lethbridge West has remarked on it to him on many occasions, we still have a significant number of people in Lethbridge who are without a family doctor. So we certainly have the announcing. We've had several announcements about the reside funding and the $2 million per year that has been committed there for 3 years to provide, I guess, about 20 new family doctors, according to the Minister, per year for rural areas. But What, Minister, is there any steps being taken, any funding being dedicated specifically to addressing the situation in Lethbridge? I understand that the South Zone has expressed interest in an incentive program of some sort. Are you putting any additional funding into addressing this crisis in the Lethbridge area?
Thank you, Member Minister.
So thanks to the honourable member for the question. You know, there is going to be so additional funding has been provided already, and this is in the form of through PCNs for nurse practitioner in that particular area. You know, AHS is also undertaking to and is actually my understanding is already put offers out to a number of physicians. These are international medical graduates who are going through the certification, and hopefully they'll actually get their certification in the very near future. So you know, these, you know, we recognize, as we talked earlier with Member Shepherd, that there are, you know, ongoing challenges, you know, generally in terms of getting family physicians in rural areas. The other thing that we actually are assessing is a policy change, right? So looking at how do we not only have the opportunity not only for AHS, but can we actually have potentially, you know, PCNs sponsor international grads under certain conditions. So that used to be in place at one point in time. There were challenges associated with that. So sort of family practices doing that because not being able to provide enough support in terms of going through the process. So we are actually looking right now is actually, you know, providing greater flexibility to manage that with international grads. You know, I guess the last comment is that you know, and we mentioned this, it's not only our budget, which is focused on, you know, we have the $90 million, which I've mentioned before, which continues from last year into this year for rural physicians. But there also is, you know, the budget in terms of, you know, supporting healthcare practitioners generally and targeted support in terms of our post-secondary institutes with our colleague in advanced education.
Thank you so much, Minister, and that moves our time over to the caucus. Government caucus, and I believe Member Reid is going to take the question.
Thank you, Madam Chair, and through you to the ministers. Thank you so much for your time today. It's been a long day, and we'll try to end this well for you. Have certainly appreciated your answers, the insight that you've given us into the 2022-23 budget. Very happy to hear that you are so forward-looking. And we are talking about things like sustainable health care in the future for our children and our grandchildren, and I think that's fantastic. I've appreciated the work that you've been doing over the last couple months and are doing in this budget in relationship to things like the rural EMS crisis, which of course is personally very important for me and for my constituents in Livingston-McLeod. And I also am glad that you realize that the answer to this is not just throwing money at the problem. While we have seen some increases in the budget, I'm very pleased to hear that we're talking about some changes to implementation, the way we manage, looking at policies and processes that will help us create a more stable, sustainable healthcare system for our province. So I want to thank you for that. I do want to ask a quick question related to capital grants. Estimates line 15.1 says $51 million is listed in 2022 for continuing care beds. We've already seen some great news with the announcement of the investment in the Red Deer Hospital and some other positive announcements throughout Alberta. But can you provide me some details on other capital investments in your ministry's capital plan?
Thank you, Member Minister.
Well, thank you to the honourable member for the question. You know, budget 2022 invests $3.5 billion over 3 years. That's more than $1.2 billion in 22-23 in capital funding for health facilities, equipment, and IT systems. This includes $2.2 billion for new and ongoing healthcare projects and programs, $474 million for capital maintenance and renewal of existing health facilities, $87 million for health department IT projects, and $758 million for AHS capital, such as parkades, equipment, and other capital requirements. And this is all financed by AHS own source revenue or borrowing. Now, our government has made the $1.8 billion commitment to redevelop and expand the Red Deer Hospital. That we've spoken earlier today about this. Obviously, we also confirmed that's not all in this budget, but over a period of a multi-year period. We also included an $81 million commitment plus another $17 million provided by the Universal Hospital Foundation to construct the University of Alberta Hospital Brain Center, which very excited about here in Edmonton. We remain committed to completing ongoing major projects and look forward to opening the new Calgary Centre, as we talked with Member Shepherd, in 2023, and to continue the work on the new hospital in Southwest Edmonton. Budget 22 capital highlights also include $193 million over 3 years to redevelop and expand the Red Deer Regional Hospital Centre, that as indicated, part of the $1.8 billion commitment. $46 million over 3 years to develop the new Lacrete Maternity and Community Health Centre, which will include a birthing centre with a midwifery-led program, a new EMS response facility, and more space to access mental and primary health care. And $36 million to build additional spaces in recovery communities, which are therapeutic, supporting living spaces where clients receive addiction treatment with life and social supports. And Minister Ellis has spoken to that earlier today. It also includes $35 million to add 11 new operating rooms in the Foothills Medical Center, and I was very pleased to make that announcement a few weeks ago, which is part of our overall $133 million allocation for the Alberta Surgical Initiatives to expand capacity both within our hospitals and that the capital funding is for expanded capacities in our hospitals, and we are also expanding capacity through our CSF initiative. There's $204 million over 3 years to modernize spaces across the province and add net new continuing care spaces and priority communities, and $45 million. And I know Member Reid, this will excite you in particularly regarding to the Rural Health Facilities Revitalization Program. So there's $45 million last year and an additional $45 million this year, and really to improve the service in rural Alberta and to upgrade a number of facilities that are there.
Thank you so much, Minister. Member?
Fantastic, thank you for that. And you're right about that. The Rural Health Facilities Revitalization Program. So that leads right into my next question. Was privileged to be a part of those announcements, and I think some much needed attention to some of our rural healthcare facilities to just help them to continue to care and provide great patient outcomes for rural Albertans without the need to have to head into our urban centers all the time. Mentioned that we've got some more funding in this budget, but can you give us an update on where we are with the elements that were announced last year in terms of where those projects are at?
Thank you, Member. Minister?
Thanks so much to the Honourable Member for the question. There are 21 rural health projects currently supported by this program. To date, $50 million has been committed under this program, with a further $15 million available in fiscal 24-25 as part of Budget 2022. And if I can just, I'll just very quickly go through the list of projects. We have one project in Cardston, which is currently status is under construction procurement. Similarly, one in Crow's Nest Path. In Brooks and Tabor, there are two projects that are both in the design phase. In High River, there are two projects in High River. Both of them are out for tender. Didsbury Hospital, the Clares Home General Hospital, Wetaskiwin Hospital, and Care Center Emergency Department renovations, and the Wetaskiwin Hospital Care and Center Medical Device Reprocessing Innovations. They're all currently in the design stage. The Olds Hospital, Drayton Valley, and Westview Center are also in the design stage, as is the St. Therese St. Paul Healthcare Center Emergency Department renos. Two other projects are in planning stages. This include the Peace River Community Health Center and the Fairview Health Complex Lab renovation. There's a number of health facilities that are being in a demolition or being planned for in demolition. That's in the planning stage. Pincher Creek has their health center CT scanner renovations are under construction. Sundre Hospital and Care Center is in design, and the Lloydminster Renal Dialysis Unit is in the planning stage. So we have as I indicated, 21 rural projects currently supported the program, and there's more to come.
Thank you, Chair. Through you to the Minister. All very good news for rural Albertans and rural healthcare, so thank you. Referring to your fiscal plan, page 155, states that the pandemic has put unprecedented pressures on our health system and our frontline workers. Are we ready to handle another wave with without the same level of disruption? As I mentioned in the House yesterday, I've had the last 2 months to watch our frontline workers be amazing. I've watched the extra processes that they've had to go through to deal with potential exposure to COVID. Just the extra time it takes in their already busy days. But they're tired. That's evident. So just related to that, I'd like to know regarding the well-being of our frontline workers, how are you working, or how are you planning to help prevent burnout and help sustain our frontline workers through investment through Budget 2022?
Thank you, Member. Minister?
Thanks so much for the question. And first of all, once again, thank the tremendous work done by our healthcare workers in terms of getting us through 5 waves of COVID. This is like 5 incredibly bad flu seasons, and it just doesn't stop. It's not once a year. It's 5 in a 2-year period. So thank you to them for that. And when I was appointed as a Minister of Health, one of the key objectives I was given is we need to recognize that COVID's going to be with us for a while. We need to, quite frankly, normalize it within our system. That we can't expect our staff to be doing high dives every time there is a wave. And so we made a commitment to provide funding for permanent capacity. Now, as part of the work that was done with Ernst & Young in terms of doing an assessment of our capacity, which, particularly our ICU capacity, which was the lower than, on a per capita basis than any province across the country, we did the assessment and determined that we needed, on a permanent basis, we need 50 additional ICU beds. So this budget includes $100 million per year over the next 3 years to build that capacity. And so part of that is, and then hiring the staff for that. Now, there's, as we talked earlier today, that, there's challenges to hiring the staff, but we have plans in place, both short, medium, and long term, to be able to do that. And that hiring is actually ongoing. We have more staff now. We've actually hired through the pandemic. We have more staff now than, significantly more staff than we did 2 years ago. Look at the number of nurses, approximately, 1,700 nurses have been hired to be able to manage, but we know we need more. And then we also know they need to be flexible to be able to move back and forth between different, whether it be supporting surgeries or supporting ICUs, and be able to flex up so that we don't have to do the high dives when this hits us. We know it's going to be coming at us, and have the contingencies plans in place to be able to manage through that, and quite frankly, support Albertans and support our staff.
Thank you so much, Minister. Over to the official opposition. Please proceed, Honourable Member.
Thank you, Madam Chair. So I'd like to direct this question to the Associate Minister. And back in March of 2020, there's a Globe and Mail article where the Chief of Staff of the Associate Minister gave specific details about treatment beds in Alberta. He said 1,396 treatment beds in total, and then they're broken down by some funded by AHS, contracted by AHS, supported through government plans, the ones on reserve, and others not financed by the government. So I'd like the Minister of, the Associate Minister to please update those numbers as they are today.
Thank you so much. Honourable Member. Minister.
Yeah, thank you, sir. Just a moment here. I knew we saw that sheet, and the ADM here is attempting to locate it for you. Yeah, thank you. So as I mentioned earlier, I'm happy to go over the list here, but Alpha House, so these are newly funded spaces. So Alpha House, 2,184. Simon House Recovery Center, 229. Recovery Acres Society, 199. Fresh Start Recovery Center, 98. Alcove Addiction Recovery for Women, 78. Sunrise Healing Lodge Society, 52. Aventa Recovery Center of Excellence for Women with Addictions, 43, and that was in the Calgary area. In Edmonton, we have the George Spady Society, 1,820. Poundmakers Lodge Treatment Centers, 560. Jelnik Society, 68. Our House Addiction Recovery Society, 31. Salvation Army Edmonton, 22. Recovery Acres Society of Edmonton, 20. McDougall House Association, 6. In Southern Alberta, we have the Kainai Nations Bringing the Spirit Home Safe Withdrawal Management Site, 1,251. Foothills Center, 832. McMahon Youth, Family and Community Association, South Region, 65. Alpha House Society, 48. Southern Alcare Manor, 44. In Central Alberta, we have the Thorpe Recovery Center, 574. Drumheller Society for Recovery's Grace House, 14. And Northern Alberta, the Bonnyville Indian Métis Rehab Center, 104.
Thank you, Minister Member.
Thank you, Madam Chair. So the Minister has listed the spaces. I was wanting to know about the total number of beds.
Yeah, we'd have to, yeah, depending on the program lengths, the department would be able to get the breakdown of the beds.
So I asked the Minister to be able to table that so that we could have those numbers.
Certainly, the department will get back to you. Thank you.
Thank you. And of these, recently the Minister has announced 8,000 spaces, these new spaces for treatment from the creation of new beds versus existing beds. Can you differentiate that? Madam Chair?
Please proceed.
Sure. Well, thank you. As indicated, and you've heard me say this, obviously the 140 million over 4 years, the increased access to addiction and mental health services and supports. The commitment included getting people on a pathway to wellness, and we had the 4,000 addiction treatment spaces to the publicly funded continuum of care, and this was achieved through funding new beds, funding existing unfunded beds and outpatient services, and upgrading existing detox spaces to medically supported detox spaces. Now, prior to this commitment, there were approximately 19,000 publicly funded addiction treatment spaces in Alberta. The provincial government is now funding almost 27,600 addiction treatment spaces annually, and this is a 45% increase for the funding capacity.
And for the last question.
And, sorry, for the last question, addiction treatment, we have 1,037, community mental health, 875, beds, but, pardon me, they had the answer for you, member. The addiction treatment beds, 1,037. This is as of March 31st, 2021. Community mental health beds, 875, psychiatric standalone, 928, and that's total 2,840 beds.
So much, Minister. Member?
Yeah, and the user fees are, of course, gone.
Yes, thank you very much, Madam Chair. Now I'll go back to the Minister of Health. And the Minister has talked quite a bit about how important it is to keep seniors in their communities, aging in the community, of course, and there has been an increase in home care. And when we were talking earlier about continuing care, he did say what's most important is that we keep seniors in their communities, which I completely support. But it's very difficult to do that if there isn't supports for seniors in their community. So home care is one aspect of it, but there is non-medical supports that are needed to keep seniors in their communities, and this is oftentimes people, governments are relying on civil society, community-based organizations to support them, and there's many non-medical supports that just aren't being supported at all by this government. Things like housekeeping, laundry, meal preparation, delivery, snow removal, caregiver support, preventing social isolation so people are connected, system navigation, transportation. And another thing that's really missing in this sector is there's no case management for older adults. We have case management for children, we have case management for newcomers to our province, but if we want to keep seniors in their communities, we really need to have a case management system. And I just want to know what the Minister of Health is doing to support these non-medical supports. Madam Chair?
Thank you so much. Minister?
So I want to thank the honourable member for the question. I fully appreciate that, although our budget has additional funding for home care, which will, enable, more Albertans to be able to take advantage of that. When we look back in terms of the report for the facility-based continuing care report, it highlighted the need that if we want to keep have people stay at home and support them at home. Not only is it be able to provide additional home care, but they may actually have to provide additional supports. So, that is primarily the responsibility of my colleague, the Minister of Seniors and Housing. But I can share with the honourable member that we are actually having conversations about how we do this going forward to be able to provide more, support to seniors. Whether it be leveraging civil society or other approaches, because quite frankly, we need, we have roughly, and this has been highlighted in the report, but the rough estimate is about approximately 20% of seniors who go into continuing care don't actually need that level of care. What they need is actually more supports at home so they can stay at home with lower levels of potentially in terms of health care. So I do know that my colleague does provide seniors supports. And my understanding, it's we'll be providing it provides 5.7 million. Over four initiatives to be able to do that, but we will be having, as we develop our longer term response to the FBCC, we'll be having further conversations of how we can support seniors at home. It's not just about providing health, which is my area of responsibility, but providing other supports so we can actually keep people at home longer and not in continuing care.
I appreciate the government is thinking about the importance of this, but the fact is that the Seniors and Housing Ministry has cut significantly in this area. It used to be 2 million, and now it's only 900,000. So there's some kind of mix-up with community grants and a lot of agencies, especially in rural Alberta too. People are, keeping their communities together just by their own sheer will, and government needs to support that. So I hope that the Minister of Health is talking to the Minister of Seniors and Housing about this, because her budget has been slashed in this area, and that's a significant concern.
Thank you so much, member. Now our time will move over to the Government Caucus. Please proceed, member.
Well, Madam Chair, thank you very much. And really, who would have thought 6 hours would not be quite enough time? We still have some questions. So it's been a great day. I'd like to actually, through you, Chair, direct a question, try to get one last question in to the Associate Minister for Mental Health and Addiction. And I want to say thank you again for the work that he and his ministry and his predecessor have done in terms of being very intentional about addressing the very real needs of mental health and addiction in our province. So looking at page 127 of the fiscal plan, spending is approximately $1 billion on mental health and addiction, and budget 2022, there's an investment of an additional $20 million to further implement a recovery-oriented system of care. In addition to that, the government has, of course, eliminated user fees on all publicly funded treatment spaces, expanded treatment spaces in the province, and upgraded our medical detox supports across the province. While we know it's true that the addictions recovery continuum of care has been underperforming for many years in this province, and the result has been that Albertans have continued to struggle with very serious health issues related to addiction. To you, Minister, if you can tell us, how do you see these initiatives improving access to and the quality of these much-needed mental health and addiction services to Albertans?
Member, thank you for the question. I think as I indicated this morning, certainly COVID's brought to light the seriousness, of course, of mental health with addiction. And, we're proud. We're proud to have brought forward a recovery-oriented system of care. Look, there's a lot of jurisdictions that are quite frankly, all throughout Canada, all throughout the United States that are facing these very complex problems. But, we're leading the country right now. And I'm proud to say that I've reached out to many colleagues in other provinces, certainly with the Select Special Committee on Safe Supply. There were a number of experts, international experts in the field of addiction medicine that from what I'm aware of, have certainly been very impressed with what we're doing here in Alberta. As I've said before, this is a very complex problem with no one single solution. We've now had a number of programs, the DOORS program as an example, Digital Overdose Response System. You heard me talk about this morning about the Virtual Overdose Dependency Program, the elimination of user fees, as I mentioned earlier this morning as well. In the past, under previous governments, you had to be either wealthy or you had to be on social assistance. And even then, you probably weren't getting the help that you probably should deserve. And by eliminating those user fees and leveling the playing field so that anybody who is wanting help with addiction, we have to make sure that those supports are in place. And as I've said before, it's comprehensive. And, I call it the continuum of care, right? So that's from the person entering into the system to all the services that are provided in the middle to, of course, when they're successful, they build up their recovery capital so that they can
Thank you, Minister. I apologize for the interruption, but I must advise the committee that the time allotted for consideration of the ministry's estimates has concluded. I would like to remind committee members that we are scheduled to meet Thursday, March 17th, 2022 at 9 a.m. to consider the estimates of the Ministry of Justice and Solicitor General. Thank you, everyone. This meeting is adjourned. All right.
Good evening. I'd like to call this meeting of the Standing Committee on Private Bills and Private Members' Public Bills to order and welcome everyone in attendance. My name is Brad Rutherford, the MLA for Leduc-Beaumont and the chair of the committee. And I'd ask that members and those joining the committee at the table introduce themselves for the record, and then I will call on those joining in by video conference. We will begin to my right.
MLA Jeremy Nixon.
Good evening, Peter Singh, MLA Calgary East.
Martin Long, MLA West Yellowhead.
Mickey Amory, MLA Calgary Cross.
Todd Lowen, MLA Central Peace.
Janice Irwin, Edmonton Highlands, Norwood.
Laurie Sigurdson, Edmonton Riverview.
Good evening, everyone. Chris Nielsen, MLA for Edmonton Decor.
Good evening. I'm Trafton Koenig with the Parliamentary Council Office.
Good evening, Nancy Robert, Clerk of Journals and Committees.
Good evening, Warren Huffman, Committee Clerk.
Thank you. And going online, I see one MLA Sweet. Go ahead.
Good evening, Heather Sweet, MLA for Edmonton Manning.
Thank you. And if anybody else joins, I'll just ask them afterwards to introduce themselves. One substitution to note, MLA Singh for MLA Fry. A few housekeeping items to address before we turn to the business at hand. Please note that the microphones are operated by Hansard staff. Committee proceedings are live streamed on the internet and broadcast on Assembly TV. The audio and video stream and transcripts of the meeting can be accessed via the Legislative Assembly website. Members participating remotely are encouraged to have your camera on while you're speaking, your microphone muted when you're not, and remote participants who wish to be placed on the speakers list are asked to email and send a message to the group chat to the committee clerk, and members in the room are asked to please just signal the chair. Please set your cell phones and other devices to silent for the duration of the meeting, please. And moving on to point 2, approval of the agenda. Are there any changes or additions to the draft agenda? And if not, can I get a motion to move the agenda? MLA Long caught my eye has moved that the agenda for the March 15th, 2022 meeting of the Standing Committee on Private Bills and Private Members' Public Bills be adopted as distributed. We will start in the room. All those in favor, please say aye. Anyone in the room opposed, please say no. And moving online, all those in favor, please say aye.
Aye.
Thank you. That motion has carried. And moving on to approval of minutes. Members, we have the minutes from our previous meeting to review. Are there any errors or omissions to note? If not, would a member like to move for the approval? Thank you. Mr. Nielsen has moved that the minutes of the November 1st, 2021 meeting of the Standing Committee on Private Bills, Private Members' Public Bills be approved as distributed. All those in favor in the room, please say aye. Anyone in the room opposed, please say no. And moving online, all those in favor online, please say aye.
Aye.
Thank you. That motion has carried. Moving on to agenda item 4, private bills. So in section A, we're going to review the procedure for private bills. Members, part of the committee's mandate includes the review of private bills and petitions received for private bills. On Friday, committee members received a memo from Parliamentary Council that reviews the mandate of the committee with respect to private bills. And at this time, I would invite Mr. Trafton Koenig of the Office of Parliamentary Counsel to provide an overview of the memo and answer any questions members might have about the committee's procedure for private bills. Sir, go ahead.
All right. Thank you, Mr. Chair. So I'm happy to provide the committee with a brief refresher on the private bills processes. The committee's been through this process a few times now already. So I'll just start by noting that the rules that govern private bills are found at Chapter 8 of the Standing Orders. So the important thing to keep in mind with private bills is that although they only touch on a specific individual or group of individuals, rather than the public at large, once a private bill is passed, it becomes law like any other law in Alberta with the same force and effect. So in terms of this committee's role, if the committee is satisfied today that the requirements as set out in Standing Order 94 have been met with respect to each petition for a private bill, the chair will report that to the Assembly and the bills can be introduced for first reading. The bills will then stand referred back to the committee, and the committee will hold a hearing and eventually make a recommendation on whether each bill should proceed, not proceed, or proceed with amendments. Depending on the recommendation of this committee and whether or not the Assembly concurs with that recommendation, each bill will then either progress through the normal consideration process or it will be dropped from the order paper. And that is a very brief summary of the process, but I'm happy to answer any additional questions from committee members.
Well, thank you for that overview. Any questions at this point? Seeing none, I guess we'll move on to section B, review of the petitions received for private bills. So as discussed in the memo from Parliamentary Council, 2 petitions for private bills were received by the deadline of March 9th, and at this time I invite Mr. Koenig to provide a brief overview of these petitions. Back to you.
Thank you. This is probably the most talking I've done in a very long time at one of these committee meetings. So the documents that are, as mentioned, the documents that are required to petition for a private bill are set out in Standing Order 94, and that includes 2 letters of petition, one addressed to the Lieutenant Governor and one addressed to the Legislative Assembly. Statutory declaration confirming that the petitioner has provided public notice of the petition by advertisement in the daily newspaper in Alberta once a week, once a week for 2 consecutive weeks. A certified check in the amount of $500 for bills that are 10 pages or fewer. And the name of the member of the Legislative Assembly who has agreed to sponsor the private bill. And finally, 2 copies of the draft private bill that are in appropriate format. The fees and documents have to be submitted to the Clerk of the Legislative Assembly by the relevant deadline, which in this case for this year was March 9th, 2022. So as noted in the memo that was circulated on Friday, 2 petitions have been received this year by the deadline. PR1, Calgary Young Men's Christian Association Amendment Act 2022 is sponsored by Mr. Matt Jones. Shannon Dorham, President and CEO of the Calgary Young Men's Christian Association, has submitted a petition for a private bill to amend the Calgary Young Men's Christian Association Act. And the second one is Bill PR2, Calgary Heritage Authority Amendment Act 2022, sponsored by Mr. Jeremy Nixon. That was submitted by Janet McCready, Board Chair, and Josh Traptow, General Manager of the Calgary Heritage Authority, who submitted a petition for a private bill to amend the Calgary Heritage Authority Act. A draft of both proposed bills has been provided on the committee's internal website, and it's my opinion that both petitioners have fulfilled the requirements set out in the standing orders. As noted in my memo, any member of the committee who wishes to look at the petition documents can do so, and I have them here tonight, or you can contact the Office of Parliamentary Counsel if you wish to have a look at them later. So at this point, I am happy to answer any other questions about the petitions for Bill PR1 or PR2.
All right, I will turn it over to the committee. Any questions on these bills? And then I will just take a moment to have MLA Rosen introduce herself for the record, please. And we will try that again shortly, to have her introduce herself. Any questions? Okay, hearing and seeing none, thank you for the briefing and the update. As these petitions seem to be in compliance with Standing Orders 90 to 94, this will complete this aspect of the committee's review of the petitions unless members have any comments or concerns that they wish to raise. That's my pause to see if there are any. Nope, seeing and hearing none. So in accordance with Standing Order 99-1, I will provide an oral report to the Assembly on Wednesday, if possible. Wednesday, on the committee's review of the petitions, following which the bills PR1 and PR2 may be introduced by their sponsors, Mr. Jones, member of Calgary Southeast, and Mr. Nixon, member of Calgary Klein. And moving on to section C of our agenda, scheduling of hearing and deliberations. So the final portion of this is to deal with scheduling a hearing regarding bills PR1 and PR2. So the past practice of the committee is usually to...
Is now joining.
Yeah, sorry, I'll just pause there. So whoever phoned in, are you able to introduce yourself?
Yes, sorry, this is Miranda Rosen, MLA for Banff Kananaskis. I was in on the Teams before, but as I'm driving, I just dialed it on the phone line.
Okay, well, appreciate that. You have now introduced yourself for the record, so I guess we got that done as well. Thank you, MLA Rosen. Just on the point I was making, we need to follow sort of the past practice, which is to set a meeting for a public hearing about 3 weeks from today, which would take us approximately April 25th at 8 a.m. would be a time and date that we would be able to do this. It is important to set this date so that Parliamentary Council is able to inform the petitioners of the date and so that they are prepared for it as well. But I will need a motion. If somebody would like to move that we set the date and time for that. MLA Amory has got my attention and has moved, I believe, that the Standing Committee on Private Bills and Private Members' Public Bills meet to hear from the petitioners for Bills PR1 and PR2 and hold deliberations on Monday, April 25th, 2022 at 8 a.m. All those in favor of the motion in the room, please say aye.
Aye.
Anybody in the room opposed, please say no. And then moving online, all those in favor of the motion online, please say aye.
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 And that was both, so that motion has carried. Moving on to agenda item 5, review of Bill 202, Public Health Transparency and Accountability Amendment Act 2022. So the presentation will be by Mr. Todd Lowen, the MLA for Central Peace Notley. Members, Bill 202, the Public Health Transparency and Accountability Amendment Act 2022 was referred to the committee on Tuesday, March 8th, 2022 in accordance with Standing Order 74.11, and the committee's report to the Assembly is due on March 22nd. On that note, I would like to invite Mr. Todd Lowen, the MLA for Central Peace Notley, to provide a 5-minute presentation on the bill, and then I will open up the floor to questions from committee members. So I will now turn it over to Mr. Lowen. The floor is yours.
Okay, thank you very much, Chair, and thanks, committee, for meeting with me here tonight. Bill 202, the Public Health Transparency and Accountability Amendment Act 2022. This bill will democratize the Public Health Act by enhancing transparency and accountability. This bill does two main things. It ensures public health orders are tabled in the legislature and gives members the ability to debate, amend, enhance, or revoke the order. In the case of the extension of state of public health emergency, it needs to be brought forward and voted on in the legislature. So why the name? This bill will enhance both transparency and accountability. This bill will enhance transparency because tabling the orders in the House will help reduce misinformation and confusion around the orders and enhance clarity for members of the Assembly who spend their days engaged with their community. This bill will enhance accountability because this will allow MLAs the opportunity to speak on behalf of their constituents and to do the very important job of bringing their constituents' interests and perspectives into the Assembly. I know we've all had constituents emailing our offices about what they consider some of these health orders are. And we know that some constituents have brought forward emails to our offices to make very valid concerns. There's concerns about mental health, concerns about economic damage, concerns about rising opioid addictions, concerns about children and youth development, or even just clerical inconsistencies in the rules. The Premier himself has acknowledged his government made a mistake in the beginning by only allowing big box stores to stay open. Imagine if we could have addressed that self-admitted error more quickly. The biggest lesson we learned during COVID is just how multifaceted the impacts of these restrictions became. There was not one clear expert on everything. So this bill will allow for the MLAs from both sides of the aisle to better represent their constituents. This allows for more collaboration and input from the opposition side. The opposition did not have an opportunity to speak on any of these orders in a legislative setting. And while the official opposition might have argued for enhancements of orders that other members here may disagree with, discourse like that is far more productive in the chamber than it is on Twitter. This bill is about giving the opportunity for sober second thought on health orders and on extending a state of public health emergency. So what inspired the bill? Well, I asked people that I met for months what to do with my private member's bill. Their most common concern was the health orders. And one of the most common comments was, how does this work? Can we change this? They wanted to fix the Public Health Act. We also wanted something that considered the democratic protections built into the Emergencies Act. We all seen from Ottawa that they had 7 days to debate and pass the Emergencies Act. That's not the case in Alberta. The work of the Select Special Public Health Act Review Committee and quotes from Dr. Dina Henshaw heavily influenced the direction of this bill. In the final report to the Public Health Review Committee, under number 1, it says, that the Act may be amended in relation to orders issued under the Act that apply to the general public as follows. And under D, it says, revise the Act's provisions as necessary to clarify that an order declaring a state of public health emergency made under Section 52.1 cannot lapse and subsequently be reinstated without the approval of the Legislative Assembly, provided that the Legislative Assembly is able to sit. This is exactly what this bill does on page 3. Under E, it says, revise the Act's provisions to ensure that all ministerial orders issued under Section 52.1 cannot be renewed without the approval of the Legislative Assembly, provided that the Legislative Assembly is able to sit. And this bill will allow the opportunity to move a motion to disallow the renewal of an order where it makes sense. We were also inspired by recommendation 2 and 3. That the government of, and number 2 says that the government of Alberta explore options within the Public Health Act to include provisions that would ensure the government of Alberta provide briefings to the official opposition and any other member of the Legislative Assembly. So the tabling of orders and the ability for members to ask for discussion on the orders are reflected in this bill. There's nothing in this bill to compel the legislature to sit, and we can't compel briefings, but we can encourage, and these tablings will do that. We'll have that encouragement. And under number 3, that the committee expresses its support for the inclusion of the sunset clauses under Section 52.1 of the Public Health Act and recommends to the Government of Alberta that it review all existing sunset clauses on orders made under Section 52.1. So sunset clauses can be made by motion in this process described in the bill. And I just want to close with a quote from Dr. Hinshaw. She says, quote, again, recognizing that there needs to be checks and balances, there needs to be assurances that there's not going to be use of this act in an inappropriate way. I would advocate that tools not be taken out, but rather, if additional checks and balances are needed, that those be put in, end quote. So this brings the checks and balances to this bill. Thank you.
So MLA Lowen, I just want to double check, any sort of final thought you wanted to wrap up, or did you time that nicely?
That was very tight, but yeah, maybe I'll just say that this bill brings in those checks and balances that, that Dr. Hinshaw mentioned in that quote, and I'll leave the comments as is now. Thanks.
Okay. Thank you for that 5-minute presentation. I will now open it up to the floor for 20 minutes of questions, and we can start with the NDP. Please go ahead.
Thank you very much, Mr. Chair. One of the questions I have is just, I think the bill says that 2 members could trigger a debate, and that's quite a low number, and I'm just wondering if you see any concerns with that, or will that create quite a bit of chaos when so few people can, you know, create the threshold to have this debated?
Okay, the reason I chose 2 was the fact that in Robert's Rules of Order, you have a mover and a seconder to bring forward anything to be discussed in a meeting. So that's why I used the number of 2. Obviously, I think, you know, if there was just one person that was interested in this discussion, then I would say no, that probably isn't appropriate. But again, just under regular Rules of Order, I thought that the 2 was the proper number.
Thank you. Go ahead with a follow-up if you have one.
Yeah, there were many public health orders that were made, of course, during this pandemic, and looking back to how quickly measures came in, could you see that it might create, like, that every measure be debated, it might create even more, you know, upset or chaos because, you know, the orders come in, and how can we, you know, expediently respond to them? I don't know if you thought that through.
No, and I appreciate the comment for sure. There's nothing in this bill, of course, that restricts the ability for the Chief Medical Officer of Health or our cabinet to make the orders. So I just want to make sure that that's clear, that there's nothing to restrict that activity. And but what it does do is provide that opportunity to be brought before the House. Now, of course, nothing would be debated unless it was asked to be debated by any 2 members. And I think that when it comes to these health orders in the state of emergency, those are very important things, and I think that's what we do in the legislature is very important activities. So I think that things that are that important to the public that have created the desire to have the health order or the state of emergency to be called. I think those are important things, and again, that's what we do in the legislature is debate and discuss and vote on very important things. So I think it's reasonable to do that. I'm not sure that everyone would have been brought forward to debate. I think there's many that probably wouldn't have been, but obviously the ones that maybe that were more controversial for some people in some constituencies, I think that they may have been brought forward.
All right, we will go over to Emily Nixon for a question and a follow-up.
Thank you, Mr. Chair. I guess I was just kind of leading off of what MLA Sigurdsson was, I think, going after there. And, you know, this act, of course, is more than just COVID. There could be any other health act or issues that could happen in our society. And I think the importance for governments to be able to respond quickly, and that's the way that it's set up right now with the CMO coming and meeting with cabinet, making recommendations, and then being able to move quickly. So just to clarify then that what we're proposing here would not restrict their ability, if the legislature is not sitting, to be able to act now, and what we're doing is revisiting it next time we're in session to be able to debate what took place.
Yes, exactly. There's absolutely nothing in this bill that affects that process, that initial process to bring the health orders into effect or the state of emergency into effect. Nothing in this bill affects that at all. It is just that opportunity to discuss it in the legislature when it sits next. There's nothing in the bill to compel the legislature to sit. So if it was the legislature wasn't sitting for a week or a month, then that's when it did sit next, that's when they would be tabled. If we're sitting in the legislature, then it would be tabled within 1 day.
Okay. And so then we would have a debate, and that would change something that likely or maybe could have happened months before? Is that kind of the idea, or that we would make sure it never happened again if we disagreed with it?
Yeah, it would only affect that order itself, and it would only affect that order moving forward. Okay. So it's like, again, it's kind of that sober second thought where you kind of get a chance to review what's been done. And I guess the longer period of time that it's actually been in place might have that, you might have more information on how you would feel about that order. And then at that point, again, you could actually move to amend it, to enhance it, or to revoke it. And if the MLAs that didn't want to review it at all, then it wouldn't even come before the legislature.
Thank you. You did sneak in a follow-up, so I'll go over to Mr. Nielsen.
Thanks, Mr. Chair. Thanks for coming to answer some questions here. Appreciate that. So, you know, let's start asking the hard questions here. So, as we know at the beginning of the pandemic, with how COVID was spreading, the different variants and things like that, shall we say there was a surplus of information out there regarding treatment, false treatment, prevention methods, things like that. So how can we be assured that with the present drafting of the bill, you know, that evidence of that nature would not be used inside the Assembly to revoke or amend a necessary public health order?
Well, I think we have the opportunity for members to represent their constituents, and obviously there's a wide variety of opinions on all sorts of things within the public health orders that came about. And I think that MLAs are there. I think we find that we do this important work all the time. And so I guess if you're concerned about kind of the democratic process, that maybe we would somehow get this drastically wrong, then maybe we need to be concerned about all the things we do within the legislature that we could get drastically wrong, and bringing in you know, debate that isn't necessary or isn't warranted or maybe isn't even correct. So I think this is just part of the process of our jobs that we have to do with a multitude of things, including other health issues outside of these orders. So again, this is that opportunity for that sober second thought to look back and look at what has happened, what that order has done, and then and look to the future and see if it's necessary or if it needs to be enhanced or revoked.
Follow-up, go ahead. Yeah, thanks, Mr. Chair. And I noted in your opening statements you were talking about checks and balances, and so if members do want health orders to be debated in the House, and you know, I guess I'll just say it, maybe a member is using misinformation. What kind of check and balance is in place with what you're proposing to ensure that measures that we're discussing or that are being brought in are based on science, are based on the data?
And it would be just as similar to every other debate that we have in the legislature on any motion or on any bill. Members can bring in whatever information they want on anything, but of course that's our job, is to look through these things and make good decisions and make decisions based on science and proper information. And again, we do this all the time. This isn't a unique situation I'm talking about here. This is a situation that maybe is more controversial because of the pandemic that we're just coming through. But again, we do this every day in the legislature, and I think that overall, I think we have to agree that this democratic process is the best process that's available right now to take care of issues, and again, a wide variety of issues.
Thank you. We'll go to MLA Long for a question and follow-up.
Thank you, MLA Lowen. I actually saw your post online asking your constituents for feedback. I appreciate that you do have such a broad engagement with your constituents, and have relied on their feedback for such an important bill. Obviously, we don't get a lot of opportunities to bring bills forward as private members, so as I say, I just appreciate how you went about that. Now with that, I was curious if, once you made the decision to move ahead with this bill, if you had the opportunity to look at other jurisdictions and to see if they have a similar process like you're bringing forward here.
I think the best example is the Emergency Act with the federal government. And we've seen how what took place there when it was invoked. The Parliament had 7 days within which to bring it before the Parliament and have it debated and voted on. And so that was a bit of an indicator right there of the process. That maybe the timelines are slightly different, but I think it's again an opportunity with the Emergency Act, it's with the MPs, of course, in Parliament, to be able to discuss it and debate it and vote on it and pass it. And we've never had that process here with the emergency health orders and with any of the health orders. So I think that was a good process. We might not agree with the result of any of these processes, but that is the best way to go as far as democracy, is to have this brought forward and looked at and debated and discussed.
Thank you. I was hoping we wouldn't ever even talk about the Emergency Act again. But,
agreed.
But thanks for making me twitch tonight, Mr. Lowe. No, I appreciate that. The other thing, just to clarify, so did I hear correct that if the legislature isn't sitting, it's after the legislature returns and within 2 days? Was that correct?
Yes.
But if it's sitting, is it within 1 day or 2 days?
One day if we're sitting, and 2 days if it's not sitting when the health order's made, then within 2 days of when it reconvenes. Naturally not compelling to reconvene at any time, but whenever it would normally sit again within 2 days then.
Okay, thank you.
Thanks.
Thank you. We'll go to Mr. Amory, please.
Thank you very much, Chair, and good afternoon, good evening, MLA Lowen. Thank you for presenting this bill to us today. I do have a question. Maybe it would help me to put all of this into context if I gave the opportunity to give an example of one public health order that we had in the past that this bill might have worked well for. And then just, I'll give you the supplement or the follow-up right now, just in going back to what my colleague just mentioned to you. The Public Health Act debate would take place within 2 days of the date that the legislature resumes sitting.
Yeah.
Do you have any concerns about a public health order that needs to be declared while the legislature is not sitting in events that require immediate action?
Okay. The first question on example, I think one of the examples, one right off the start, where there was determined that there would be essential and non-essential businesses, and I think that was one that we it caused a lot of alarm and caused a lot of I think angst and probably a lot of loss of business for small businesses. And that was one that I think if we had had an opportunity to bring that before the legislature, that maybe we could have had an opportunity to debate that one, discuss it, and then be able to, you know, have that open and honest discussion, and maybe could have rectified that situation earlier. Of course, the Premier said afterwards that he regretted that decision from that time. And again, we all make mistakes and we all have to learn from them. But if we can identify our mistakes, the sooner the better, then I think we have an opportunity to fix that. And then getting back to the immediate nature, and do you want to just cover that one again, your follow-up question?
Yeah, just simply put, if the debate takes place 2 days after a legislature resumes sitting, I'm wondering about how this would deal with situations where a public health order needed to be declared on an urgent basis while the legislature was not sitting.
Okay, yeah, no, and that's fair enough. But yes, there's nothing in this bill that interrupts the process that exists now. So the process that we have right now, as far as the cabinet or chief medical officer, her health asking for an emergency order or a health order, though that process would be exactly the same as where it is now, so that it, you know, in an urgent need for something to happen, it can still happen in the same, you know, fast process that we have right now. So that's that process will remain the same, and it'll just be a chance to review it at the next opportunity within the legislature.
Can I just, just a very, very quick.
Very quickly.
All right. So this would not impact the chief medical officer's ability to declare a public health order. It would only give the legislature an opportunity to discuss it.
Yeah.
2 days after the legislature. Okay, I'm good with that.
Yeah, exactly. Yeah.
Mr. Nielsen?
Thanks, Mr. Chair. I guess I'll just keep going with the really tough ones here for you. You know, I don't think it's any secret. I think there were some decisions that have been made along the way that were definitely politically motivated. Do you see any concerns with what you have drafted being used, I guess, from a political perspective rather than science and data?
Okay, I think everything we do in the legislature is political. We all make we represent political parties. We go into the legislature and make decisions based on you know, some political views or some, you know, whatever situation that we have. But as far as the political motivation, I think this gives actually a greater opportunity for democracy and a greater opportunity for input from a wider group of people. If we look at the decisions that have been made so far in this pandemic, we've had the Chief Medical Officer of Health making recommendations to a cabinet committee, which is all just one political party. The opposition has no seat at that table. And this brings it into the full forum where all the political parties have an opportunity to debate and discuss and make recommendations. So I actually think this is the opposite. This actually makes it so all the political, the people from all political parties to have the opportunity to debate this openly, transparently in the legislature, which is again what we do that is what we do in the legislature is bring forward our political views, our views of our constituents into all the debates that happen in the legislature.
Okay.
Thank you. And just before your follow-up, I'll just ask everybody online to mute if you could, please. Mr. Nielsen?
Thanks, Chair. And the reason I was asking that, because as you know, I tend to dig into the legislation, you know, what does it say, what doesn't it say, what are we saying about it? And so, you know, one of the things that caused me concern right off the hop, right on page 1 of your bill under section 29, number 2 here, A, you know, right now, 2.2 currently reads medical officer of health or chief medical officer of health may, in writing, exempt a person and so on and so forth. And you're proposing to change that to may issue in the form prescribed by the minister. And so I guess that causes me some pause because we're leaving potentially up to the minister that could make a political decision rather than something that's based in science and in data.
Okay, and I consider that more of a housekeeping issue because they, right now it has it so it's may in writing exempt, but that restricts the opportunity for things to happen, but it can only happen in writing. But this allows it to be prescribed in a form prescribed by the minister, so maybe by email or by any other form of transmission. So again, I looked at this as more as housekeeping, not as an opportunity for the minister to have more say in the process, but just a say in how the data is transferred.
Okay, thank you. As we're coming into the last 2 minutes and 15 seconds, Mr. Nixon is up.
Excellent. Thank you, Mr. Chair. I guess my question is kind of still building off of what Mr. Nielsen was getting at. I think my concern is about decisions being made politically instead of based off of evidence. And I guess knowing full well that the Emergency Management Committee would sit for days on end, sometimes going over information, and things changed very quickly throughout, as you know as well. And so I guess the question I have is, how do we ensure that the information is made available to members so that they can make good, informed decisions, and especially considering the length of time, the amount of time the Cabinet did spend with the CMO and poring over the information that was in front of them.
Okay, yes, and I agree. I understand the concern about having that information, and I think that is important to make sure that everybody has that information. But again, when we go into the legislature every single day, we have very important critical decisions to make, and we make those decisions with the information that we have, that we dig out, that we research ourselves and have our staff research, and obviously, ministers bring this information to the legislature too. So I think, again, I think this is a very similar process as any bill or any motion that we're debating in the House, that as members of the Legislative Assembly, I mean, that's our responsibility to make sure that we have the information and make good decisions for the people of Alberta. And again, this is no different than anything else that we do on a daily basis in the legislature.
For a follow-up, thanks. I guess then kind of going down the vein of things change quickly, is there a provision in here, at least for us to be able to revisit decisions? So if we do have a discussion and make a decision as an assembly, and as things change, are we able to come back and revisit? Or can the CMO, if the session isn't sitting, make that change even after we've had that debate in the legislature because it's needed at that time?
Yeah, obviously, if there was a need to have another order made, then that order could be made. Again, there's nothing in the bill that interferes with that opportunity for the Chief Medical Officer, Health, or Cabinet to make those decisions and bring forward those orders.
Okay, thank you. Mr. Lowen, you're welcome to stay and hear the rest of the presentation if you like, but I appreciate your presentation and taking questions from the committee. We will now move to a technical briefing by the Ministry of Health. And we have department officials attending from the ministry to present here today, and so I want to thank you for being here as you make your way to the table. I will just talk a little bit slower as you get yourselves set up, and pause just for a moment. I'm used to 2 years of virtual where this is just instant. So joining us at the table, I ask you to introduce yourselves, but we have Ms. Trish Merrithew McCready, Assistant Deputy Minister, Public Health and Compliance Division, and Dr. Karen Phillip, Executive Director, Health Protection Branch, Public Health and Compliance Division. Thank you for joining us. You have 5 minutes as well to make a presentation to the committee.
Thank you, Chair, and thank you for the opportunity to attend tonight to comment on Bill 202. As you've just said, I'm Trish Merrithew McCready. I am the Assistant Deputy Minister of Public Health and Compliance for Alberta. And joining me tonight is one of my Executive Directors, Dr. Karen Phillip, who has been in the department for roughly a year. We understand, Alberta Health understands, that Bill 202 proposes amendments to some of the provisions of the Public Health Act relating to transparency and accountability. Alberta's Public Health Act provides a statutory authority and accountability mechanisms to protect Albertans from illness and injury, and in some cases death. Declaring a state of public health emergency is one of 4 authorities in the Act. On March 17, 2020, the Government of Alberta declared for the first time in over 100 years a state of public health emergency in response to the COVID-19 pandemic under Section 52.1 of the Act. It's extremely rare, as a result, for the government to declare a state of public health emergency under the Act. It's a very significant step. Government's declaration of a state of public health emergency increased awareness in Alberta of existing emergency authorities available in the Act. To address questions about emergency authorities, 8 government and 4 opposition MLAs were appointed to a special select Public Health Act Review Committee to provide a report with recommendations on the Act to the Legislature by October 31st, 2020. I believe they actually reported on October 12th. The Special Select Committee report formed the basis for many of the recommendations and many of the provisions in Bill 66 that came into effect on December 15th, 2021. Amendments to the Act added provisions to address accountability and transparency by requiring the minister to post the order or exemption online as soon as reasonably possible after the making of the order of exemption. One amendment requires the minister to ensure that any code, standard, guideline, schedule, or body of rules brought into force by an order or exemption is readily available to the public. Bill 66 amendments codified the practice used during the COVID-19 response. All CMOH orders were and continue to be posted on the government website. Bill 202 proposes giving MLAs additional power to revoke or amend terms or conditions of exemptions or orders made by the Chief Medical Officer of Health, by medical officers of health, the Lieutenant Governor and Council, and Alberta Health Services relating to a public health emergency. In summary, Bill 202 proposes to make actions of the CMOH and the local MOHs subject to review by the Legislative Assembly with power provided to revoke or amend the orders. And secondly, require a return to the legislature for MLAs to review an extension to a public health emergency and to pass a resolution. The current Act already provides conditions for the expiry of a declared state of public health emergency under Section 52.8 that describes that a state of public health emergency order will lapse unless continued by a resolution of the Legislative Assembly. Bill 202's proposed amendments could reduce flexibility and speed to deal with a public health emergency. The nature of public health emergencies requires government's rapid response. The proposal suggested in this bill could limit the ability of government to respond effectively in dealing with a public health emergency. The bill appears to go over and beyond increasing transparency and accountability by giving the Legislative Assembly the power to revoke or amend public health orders or exemptions. In responding to a public health emergency, there is a need for clarity, consistency, and urgency. Some of the provisions in Bill 202 could inhibit the ability to respond in a timely and effective way to protect the health and lives of Albertans. Throughout the pandemic, Alberta Health was committed to providing information regularly and transparently to Albertans about COVID-19 and the government's response. So thank you, and we would be pleased to take any questions.
Thank you. I appreciate the presentation, almost exactly on time, which is excellent to have. Any questions? I don't have anybody on the list currently. Mr. Nielsen, go ahead. Then Mr.
Thanks, Chair. Thank you for coming to answer questions and for your presentation. Maybe I'll get to an elephant in the room, but I'll first go through another direction first. So let me ask directly, do you believe that public health experts and data that's based in science, did it have enough influence over decisions that were made throughout this pandemic around the health measures that were put in place?
MLA Nielsen, I think you're asking for my opinion, and that's not what I'm here to provide you with. I can't, in all conscience, provide my own opinions.
Okay. So in order for, I think, people to be able to, and sorry, this would be my follow-up, Mr. Chair. Then would it not be prudent to simply release data recommendations so that everybody, including Albertans, can see for themselves how decisions are being made. Whether they agree or not can be another argument for another day. Because I know certainly the opposition has called for that information for the past 2 years. Would that help in people making decisions?
I think I would need to say, the question in my mind would be, would Albertans, the average Albertan, be able to understand and use the data and the information correctly or as it's meant to be understood?
Okay, thank you. We'll go to Mr. Nixon for a question.
Excellent. Thank you for being with us tonight. I guess my question is about kind of revisiting decisions that were made. So if the CMO puts a health order in place, then we debate it in the legislature and decide that we want to remove that. But then a couple weeks later, months later, the CMO decides, hey, we need to go and do this for the benefit of the public because the information available to him or her. Would she still be able to do that with Bill 202 in place?
Emily Nixon, I believe it would be possible, technically possible. The issue would be, in my mind, the time involved and what might actually transpire during that period of time. Because we're dealing with public health emergencies and situations where people's lives are often at risk, the CMOH needs the flexibility to act quickly and swiftly. If she or he, depending on the case, were required to go back to the legislature each time they either wanted to issue a new order or to extend an order, I would suggest that that might in fact imperil people's lives or the health of Albertans as a whole.
Okay, thank you.
Any follow-up?
Should be good.
Okay, any other questions?
I can ask one more.
Mr. Nixon.
Just interested if you know or if you've done any sort of jurisdictional scan, understand if there's amendments like this in other legislatures across the country.
I led the original exercise when we developed the amendments to the Public Health Act, and we did conduct a jurisdictional scan of all of the PTs in Canada. We also looked, in fact, out of Canada. There is no other province or territory that I'm aware of in Canada where the legislature actually has the authority to amend or perhaps even revoke a Public Health Order Act of a CMOH that is not already lapsed for other reasons.
Okay, thank you.
Any follow-up? No? Any other questions? I will pause. Oh, MLA Long, go ahead.
So, I'm not sure if you can answer this. Is there a role at all for legislative, like the legislative body in this circumstance? I guess, is that a fair framing of it?
I think it's a fair framing. I don't believe, though, that I can respond to that. I can't speak to the role of the legislature, what it might or might not be. I will say, however, though, that I think it's important that we, look at what a public health emergency really is versus, perhaps another kind of emergency, and the need to not bind the CMOH or local MOHs in their ability to respond in a way, that will protect the health and well-being of Albertans or perhaps even their own lives.
Okay.
Follow-up, go ahead.
The other thing I just wanted to touch on your response earlier, like when we heard the explanation from MLA Lowen about it wouldn't, like this bill doesn't stop an order from taking place, but it would be a review at the next possible time, like if the legislature wasn't sitting or if it was sitting within a couple of sitting days. So with that explanation, does it stop the chief medical officer from making prudent, rational, expedient decisions?
I don't think it would prevent the chief medical officer or a local MOH from making, a prudent decision, but it might overturn a prudent decision for reasons that might not actually be based on science or an understanding of the medical conditions or situations that are involved.
Thank you. I see the wheels turning, but I'll go to Mr. Nielsen for a question and back to you.
Yeah, thanks, Mr. Chair. I guess, the whole purpose of this bill is maybe second-guessing some decisions around things that were being made, political interference, things like that. Is there any merit maybe should the legislature look at making the chief medical officer of health an independent office of the legislature so that, we can freely see decisions being made based on science, based on the data, and free from political interference?
Emily Nielsen, I can't comment on making the CMOH an independent officer of the legislature, but I can tell you that was an option that was put forward during the original hearings about a year ago when we were looking at the Public Health Act, and it was not included in the final report.
No follow-up.
No follow-up. Emily Long, did you have a question?
I think that.
Okay if you don't.
Hey. No, I think I'm good.
You're good?
Thank you for coming in and answering questions tonight. I appreciate it.
Thank you.
Sorry, I thought you did. Any other questions for the department? Okay, hearing none. I'll give that a bit of an extra pause for those online. So I'm not hearing any. So thank you for coming today and presenting and answering questions. It is much appreciated. We will now move on to the decision on the review of Bill 202. Members, the committee must now decide how to conduct its review of Bill 202. And in accordance with our approved process, the committee may choose to invite additional feedback from up to 6 stakeholders, 3 from each caucus. Alternatively, the committee may choose to expedite this review and proceed to deliberations. Does anyone have any thoughts on this process? Hearing no, I don't want to say no thoughts because I imagine there are some, but I am not hearing any comments. So I guess we can move forward directly into deliberations. Does anybody have any comments on deliberations or potentially a motion? Mr. Nielsen.
Sorry, Mr. Chair. I guess everybody's just kind of trying to process some of the information that we've heard this evening. I have to admit, I have concerns with the bill. I think there's aspects of it that it gives me pause. I guess when you're looking at potentially only 2 members. Theoretically, maybe even derailing potential health orders that are being issued. One minute we're hearing things like, we need to be making local decisions for their area, speaking up, and I'm not necessarily opposed to that, speaking up, for our constituents, but for instance, we're currently debating a bill about taking away local jurisdictions for being able to make decisions what they feel is best on the ground. And so, maybe I'll just throw that out. I'm hoping to hear some more feedback from others, maybe get some of the discussion going, but this does tend to give me a little bit of pause at the moment. But I really would like to hear some others' thoughts.
Very fair. Appreciate you kicking it off. Does anybody else have any thoughts or questions about how we should proceed? Mr. Nixon.
I guess just a comment on stakeholders. I don't know if that's what we're discussing right now too, whether or not we want to see.
With silence, we moved on from stakeholders.
There you
So
go.
there are no stakeholders coming. We are now deliberating the bill. So the option now is to proceed with making a recommendation to the legislature that we proceed with it or not proceed with it. And so it's a pretty short motion. I could read the basic draft. It ends with one word change at the end, depending on which way you want to make a motion. But that's what we are on to right now. Do you want to finish that, or
Sure,
Mr.
yeah.
Amory's trying to flag me down as well?
No. Now that I know where we're at in the process.
Sorry?
Very good vice chair over here. I appreciate that. I think at this point, I would like to see this bill actually debated in the legislature. I think there's some good parts to it that I think merit further robust discussion. I think there's still questions that a lot of members still have in regards to how this will play out. But I'm happy enough to see this proceed personally. So I think that all members of the Assembly should have the opportunity to debate and discuss this in a more robust way. So those are my thoughts.
Would you like to make a motion?
Well, if there's no other discussion.
Mr. Amory, go ahead.
Motion based on the motion that appears on the screen.
Could you just read it into the record
Yes,
for
I'd
us,
like to
please?
make a motion that the Standing Committee on Private Bills and Private Members' Public Bills recommend that Bill 202, Public Health, Transparency and Accountability Amendment Act 2022 proceed.
Thank you. Any comments or questions around that motion? Okay, I just want to double check online if there's any questions. Okay, hearing none.
Is now joining.
MLA Rosen, you have rejoined. I appreciate that, but you're going to need to mute before we have.
Sorry about that. I lost
A
service.
mistake.
I'm just hopping back in.
Okay, thank you. I'm glad you're on. We will then move to the question on the motion, as moved by MLA Amory. All those in favor in the room, please say aye.
Aye.
Anybody in the room opposed, please say no. And then moving online, all those in favor of the motion, please say aye.
Aye.
And online, all those opposed to the motion, please say no.
No.
Thank you. That motion has carried. Okay. Members, the committee has concluded its deliberations on Bill 202 and now should consider directing research services to prepare a draft report, including the committee's recommendations. Would a member like to move a motion to direct research services to prepare the committee's draft report? And we do have a draft motion that goes with this as well. MLA Long, I'll just wait a moment for a motion to get up on the screen.
Froze up on me.
Wing it if you want. No.
Froze up on me, I can.
It's frozen, so I'll just read it in. That MLA Long has moved that the Standing Committee on Private Bills and Private Members' Public Bills, A, direct research services to prepare a draft report on the committee's review of Bill 202, Public Health, Transparency and Accountability Amendment Act 2022, which includes the committee's recommendations, and B, authorize the chair to approve the committee's final report to the Assembly on or before noon on Monday, March 21st, 2022. Just hang on one moment. And just so we're clear, I just, speaking with Mr. Huffman, it should be Tuesday, March 22nd, 2022.
Sorry, no, Monday's okay.
Apologize, I was just trying to make sure we were hitting the right day there. It will be Monday, March 21st, 2022. And we will get, that your screen's still frozen?
Yeah.
MLA Long, by any chance, was that the motion you were hoping to move?
I wouldn't have stumbled over it so much, but that's pretty much the motion that I wanted to move.
He got me back from that wheels turning comment I made. Any questions or comments about the motion? Okay, hearing none, we'll move to the question. All those in favor of the motion in the room, please say aye. Anybody in the room opposed, please say no. And then moving online, all those in favor online, please say aye.
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 And anyone, well, that was both of you, so that motion has carried. Thank you. And moving on to other business. Is there any other business to discuss? Hearing none. The date of the next meeting will be at the call of the chair. And can I get a motion to adjourn? Mr. Nielsen has moved that the meeting be adjourned. All those in favor, please say aye.
Aye.
And anyone opposed, please say no. We are adjourned. Thank you.